The military working dog hit the doorway at full stop. 70 pounds of scarred muscle, 4 combat deployments, and a nervous system that had survived things most humans never would. He stood there trembling in a way that had nothing to do with fear. Across the rehabilitation clinic, a woman in a wheelchair looked up from her exercise chart, and something passed between them. Recognition so complete it stopped the room cold. The dog broke formation, ignored every command, crossed the floor like he was finishing something that had started years ago on a roadside in a country most people in this building had never heard of. And the woman he ran to? The staff had spent 3 months treating her like she was already finished. They were wrong about her. They were always wrong about her. If this story already has you, hit that subscribe button right now, give this video a like, and drop a comment below telling me what city or country you're watching from. I want to see exactly how far this story travels. Now let's get into it. The Halverson Rehabilitation Institute sat at the edge of Millbrook, Colorado, wedged between a strip of chain pharmacies and a 2-lane road that carried more semis than passenger cars. The building itself was functional rather than welcoming. Beige brick, wide automatic doors. A parking lot with ramps that were technically compliant and practically inconvenient. The lobby smelled of industrial cleaner and the particular brand of forced optimism that comes from motivational posters no one reads anymore. Amelia Voss had been a patient here for 11 weeks. She arrived each Monday through Friday at 8 in the morning, signed in at the front desk with the same quiet efficiency she had applied to everything in her life before the accident, and wheeled herself to Bay 4 where her scheduled therapy sessions took place. She did not ask for help navigating the door from the parking lot, though it required precise timing and a shoulder brace. She hadn't told anyone was causing her pain. She did not complain about the water fountain being 6 inches too high for someone in a chair. She took notes in a small spiral notebook she kept tucked against her thigh, recording her own data, ROM measurements, pain scale ratings, the number of seconds she could hold a particular muscle activation, because she had learned early on that her chart did not always reflect what was actually happening in her body. Before the accident, Amelia had been a trauma nurse at Decker Regional Medical Center in Portland, Oregon, 12 years in the trauma bay. She had worked mass casualty events, pulled people back from arterial bleeds, managed airways in parking lots and elevator banks, and once on the floor of a hotel stairwell. She knew anatomy the way mechanics know engines, not from textbooks but from the inside, from pressure and time and the specific sound a body makes when it's fighting to stay alive. The accident had happened on a Tuesday in February. A driver who ran a red light at 43 miles per hour. Amelia's car spun twice and came to rest against a concrete median. The paramedics who extracted her were good. She knew that, even through the shock, because she recognized the movements, recognized the care. But the damage was already done. Incomplete spinal cord injury at the T11 level, significant but not total. Which meant that the question was never whether she would recover. The question was how much and how fast, and whether the people around her would let her fight for what her own body was telling her was still possible. The chair was not a sentence. She had decided that from the beginning. It was a tool, and tools could be set down. She just needed the people in this building to stop acting like it was a coffin. Sandra Okafor was the physical therapist assigned to Amelia's case, and she was the reason Amelia came back every morning without argument. Sandra was 34, built like a former collegiate athlete, and operated with a bluntness that Amelia found deeply respectful. She didn't soften progress or catastrophize setbacks. She read the data, she adjusted, she pushed. In 11 weeks, she had become the closest thing to a professional ally that Amelia had inside the Halverson Institute. Left hip flexor is firing differently today, Sandra said on a Wednesday morning in late October, her hands moving across Amelia's thigh with calibrated pressure. You feel that? I felt it last night, Amelia said. Around 10. I was doing the activation sequence and something shifted. Not pain, different. Different how? Like a signal that wasn't there before trying to find its way through. Sandra's expression didn't change, but she made a note. The real kind, not the polite kind. We'll test that in the standing frame today. I want to see if there's lateral response. Holt won't approve additional frame time. He said last week I was at my ceiling. Let me worry about Holt. Dr. Marcus Holt was the supervising physiatrist for Halverson's spinal cord unit, which meant that every significant therapy decision moved through him. He was 51, well-published, and spoke with the particular authority of a man who had never once been wrong in his own estimation. He had reviewed Amelia's case file at intake and formed a picture of her trajectory: partial recovery, functional independence, realistic goals, and he had not substantially revised that picture since, despite 11 weeks of data that told a more complicated story. He had met with Amelia twice. Both conversations had lasted under 12 minutes, she had noticed. The incident with Garrett Pellman happened on a Thursday, the last day of October, which was a detail Amelia would later think about more than she expected to. Garrett was a post-surgical knee patient in the main rehabilitation gym. Mid-40s, broad, the kind of man who filled up a room by default and seemed to consider that a personality. He had been loud since his first day, offering unsolicited commentary on the efforts of other patients, the efficiency of the staff, and the general operation of an institution he was briefly inconveniencing with his presence. Amelia had been ignoring him for 3 weeks. He made it impossible on Thursday. She was in the middle of a resistance sequence, both hands on the parallel bars on either side of her chair, running a controlled push protocol that Sandra had designed to build the muscle pathways she needed for eventual standing transfers. It was hard work, harder than it looked from the outside. Her face was neutral, her breathing controlled. She had learned not to perform effort for an audience because performance was exhausting and this was already exhausting enough. "Must be nice," Garrett said from about 8 feet away. He was supposed to be doing step-ups on a low platform, but he had apparently paused for commentary. "Getting to just sit there while they count your reps." Amelia did not look at him. "I mean it. Some of us have to actually stand up and do the work." Sandra, who was across the room entering notes, had not yet heard him. "No offense," Garrett added, in the voice of someone who had never considered offense a serious concept. "Just saying, there's a point where you have to wonder if the effort is worth it, right? Like, what's the goal here exactly?" Amelia completed her rep, set her hands back in her lap, looked at him then, directly and without particular heat, the way she had looked at combative patients in the trauma bay, who needed to understand that she was not going to argue, but she was also not going to move. "The goal," she said, "is none of your business." Garrett's face shifted, the particular micro-expression of a man not accustomed to being answered that cleanly. "I'm just saying there's realistic and there's—" "I heard what you were just saying," she turned back to her chart. "We're done." She felt him wanting to continue. She felt the room holding its breath. 2 other patients had heard the exchange. A young aide near the equipment closet had gone very still. Garrett was the kind of person who needed a last word. She waited for it. It didn't come in words. Instead, she heard the flat smack of his rubber-soled shoe on the gym floor as he moved. And when she looked up, he was closer than he should have been, the physical proximity a choice rather than an accident, and his voice dropped into something lower and meaner. "You know what your problem is? You don't know how to accept where you're at." The door at the far end of the rehabilitation wing opened. What came through it stopped everything. The dog was large and pale, a Belgian Malinois the color of sand and ash, with a scar running from his left ear down the side of his neck that was visible even across the room. He was on a lead, held by a man in civilian clothes who moved with the specific economy of motion that people carry when they've spent years in places where wasted movement gets you killed. The man was mid-30s, square-shouldered, with the kind of face that was not handsome in any conventional sense, but was the sort of face you remembered. He was speaking quietly to the intake desk coordinator, paperwork in one hand, lead in the other. The dog was not paying attention to him. The dog had stopped in the doorway. Amelia didn't understand what she was seeing at first. She was still managing the adrenaline from the interaction with Garrett, still keeping her expression controlled and her shoulders level, and so the dog registered in her peripheral vision as an interruption to be processed later. But the animal wasn't moving. I was standing at the threshold of the gym with every muscle locked, staring across the room with an intensity that was visible from 50 feet, and then his whole body began to tremble. Not with aggression, not with fear, but with something that looked almost unbearably like recognition. He pulled against the lead. Not hard, deliberately, the way a trained dog signals rather than demands. The man holding it looked down, then across the room. Then his face changed too. Amelia turned fully then, because something in her chest had responded to the animal before her brain had caught up, some deep and wordless part of her that had been very carefully locked away for 5 years and had just heard the key. The dog's name was Rex. She knew it even before the man said it. She knew the shape of him, The scar, the particular set of his head, older now, grayer at the muzzle, carrying more weight than he had in the photograph she had looked at exactly once and then made herself stop looking at. He was different. Of course he was different. 5 years and multiple combat deployments would change anything that breathed, but she would have known him anywhere. "Rex," the man said quietly. It was not a command to stop. It was something closer to permission. The dog crossed the rehabilitation gym in 11 seconds. Amelia counted afterward because she needed something to count. He moved around 2 patients, past a rack of resistance bands, between the parallel bars, and came to a stop at her chair with his whole body pressed against her knee and his head pushed into her lap with a force that was nothing like a trained dog greeting a stranger and everything like an animal who had finally, after a very long time, stopped searching. She put both hands on either side of his scarred face, and he let her. "Hey," she said. Her voice was not entirely steady. "Hey, buddy." Garrett Pellman was very quiet. The man who had come in with the dog walked across the gym. He stopped a few feet from her chair, and his expression was complicated, careful, like someone trying to navigate something they hadn't expected to navigate today. He was holding a thin folder of documents against his side. "I'm Marcus Reeve," he said. "Navy. I was Rex's handler. We came in for his evaluation appointment. He's transitioning out of service." He paused. "He's never done that before." "Done what?" "Broken protocol. In 9 years of working dogs, I've never seen him break protocol." Amelia looked down at Rex, who had not moved, whose entire body weight was still pressing against her leg with an insistence that made her chest ache in a way she wasn't prepared for. "He knows me," she said. It wasn't a question, but she said it like one because she was still deciding how much of this to open up. Marcus Reeve was quiet for a moment. Then, "Where do you know him from?" The rehabilitation gym had settled into the kind of quiet that happens when everyone in a room agrees, without speaking, to pay attention. Sandra had come back from the far side of the room and was standing near the equipment closet, her clipboard forgotten. The aide near the door had not moved. Even Garrett, still standing near the step platform, had gone completely still. Amelia kept her hands on Rex's face. He was watching her the way dogs watch people they have decided to belong to. Total and uncomplicated, which was more than she could say for anything else in her life at the moment. "It was 5 years ago," she said finally. "Eastern Afghanistan. I was with a forward surgical team. We were embedded with a Marine battalion. Our convoy had gone out for a resupply run to a FOB about 20 kilometers east." She paused. "We found him on the way back, on the side of the road. He'd been hit, shrapnel, looked like secondary fragmentation from an IED strike. He was in bad shape. Conscious, but barely." Marcus Reeve was very still. "My team wanted to leave him. We were already behind schedule, the area was not secure, and transporting an injured military working dog in a vehicle that was supposed to be quiet was a tactical liability." She exhaled slowly. "I got out of the vehicle anyway. Stabilized him, got him loaded. Took us 4 hours to get him to the nearest veterinary station. I filed a report. Then I rotated home 3 weeks later, and..." She stopped. "I lost track of what happened to him." The room was completely silent now. Marcus Reeve opened the folder he was carrying. He pulled out a single sheet, a standardized military working dog intake form, the kind that records injuries and treatments, and at the bottom of the form, in the section marked Rescue and Initial Care, there were 3 lines that he held out toward her. She read them. Her own name was in the second line, written by a veterinary tech she had never met, based on the report she had filed 5 years ago, and then largely stopped thinking about because there had been other things to think about, and she had been trying in those years to not carry more than she absolutely had to. Rescue. Unnamed SF Convoy. Forward Surgical Team. Primary first aid administered by traveling nurse, name recorded as A. Voss. She looked up at Marcus Reeve. "He's been in the system ever since," Marcus said. His voice was quieter now, with the particular quality of someone delivering information that matters more than they expected it to. 4 deployments after that one. Retired last month. High marks, full service record, no behavioral issues. Except, he glanced at Rex, except that in all the post-deployment evaluations, when they asked the handlers to note anything unusual about the animal, I wrote the same thing every time. He searches. Searches for what? We didn't know. They thought it was residual stress behavior. We tried everything. He's perfectly functional, perfectly trained, but every time we're somewhere new, Marcus stopped. He looked at Rex, who still had not moved from her lap, who was breathing slowly now with his eyes half closed. He does that, looks, like he's trying to find something, or someone. Amelia pressed the heels of both palms against her eyes for 3 seconds. Then she dropped her hands and looked at the dog, and at the man, and at the folder with her own name in it, and something in her chest settled into a place it hadn't occupied in a long time. "What happens to him now?" she asked. "When he retires out?" "Adoption," Marcus said. "He's eligible. We process through the clinic here. There's a veteran-affiliated K-9 welfare program that Halverson participates in. He gets his evaluation, his medical sign-off, and then he goes home with whoever he's matched to." The word matched hung in the air between them with more weight than Marcus had probably intended. "They match based on behavioral compatibility," he added. "The dog has input, in a sense. They look for the handler or adopter the animal responds to." Amelia looked at Rex. Rex looked at Amelia. The dog had already made his position clear. Dr. Marcus Holt came through the rehabilitation wing at 11:30, which was earlier than his usual rounds. Someone had told him about the scene in the gym. Halverson was a small institution, and news moved fast. And he arrived with the specific energy of a man who considers any disruption to his department's routine a personal inconvenience. He was 40 feet away when Amelia noticed him. She had been talking quietly with Sandra while Marcus Reeve filled out the intake paperwork at the far desk, and Rex lay on the floor beside Amelia's chair with his chin on her foot, which was the most at ease she had seen him in the 2 hours since he had crossed the room. Holt did not acknowledge the dog or its handler. He acknowledged Amelia the way he always acknowledged Amelia, with a brief nod that managed to communicate both professional courtesy and something underneath it that she had been trying to name since her second week. It wasn't contempt exactly. It was something quieter and in some ways more corrosive. It was the specific look of someone who has already decided the ending and is simply waiting for the subject to arrive there. "Ms. Voss," he stopped near the parallel bars, keeping a professional distance. "I wanted to touch base with you. I've had a chance to review your most recent progress notes, and I think we should sit down this week to discuss where we are with your rehabilitation plan." Sandra had gone very still beside her. "I have time Thursday," Amelia said. "I was thinking Wednesday. There are some adjustments I want to make before end of week." "Adjustments to what?" Holt glanced briefly at Sandra, then back to Amelia. "We'll discuss the specifics in a formal session, but I want to flag that I've been looking at your trajectory over the past 2 months, and I think there's a conversation to be had about recalibrating our expectations." Amelia set her notebook on her knee. She kept her voice even because she had learned, in 12 years of trauma nursing and in 11 weeks here, that evenness was armor. "My trajectory over the past 2 months has been consistently positive. My hip flexor activation improved significantly last week. Sandra documented lateral response in the standing frame this morning. Progress in a rehabilitation setting isn't always linear," Holt said, with the patient tone of a man explaining something simple to someone he isn't sure can understand it. "And plateaus are a normal and expected part of—" "I haven't plateaued." A beat of silence. "I've been tracking my own data," Amelia said, alongside Sandra's clinical notes. "My left tibialis anterior showed voluntary recruitment last Thursday. My hip flexors are activating at an average of 20% higher threshold than my intake baseline. I've had 3 separate instances in the past 2 weeks of sensation below my injury level that wasn't present in my first month. That's not a plateau. That's acceleration." Holt's expression did not change, but something behind his eyes made a small, involuntary calculation. "Self-reported sensation is—" "I'm a trauma nurse with 12 years of clinical experience," Amelia said. "I know the difference between referred pain, phantom sensation, and voluntary neural signal. I know what I'm feeling." Another silence. This one longer. "Wednesday," Holt said finally. 2 o'clock. We'll go through everything then." He turned to leave, then paused, as though he'd just thought of something. "And while the K-9 program is a wonderful institutional initiative, I'll need that animal to be kept out of the therapy bays during active sessions. Liability." He left. Sandra waited until he was through the door, then very quietly, "He's going to cut your sessions." "I know." "He's going to say plateau and patient-centered goals, and realistically achievable outcomes, and he's going to reduce you from 5 days to 3. I know. Amelia looked down at Rex, who had lifted his head when Holt entered the room and had not put it back down. He's already decided. He just hasn't told me yet. What are you going to do? She was quiet for a moment, watching Rex, who was watching the door Holt had walked through with the focused attention of an animal who has learned that some humans are worth tracking. I'm going to make sure that when he tries, she said slowly, there's so much documentation in my file that he'd need a lawyer to explain why he's ignoring it. She looked at Sandra. Start with this morning's standing frame data. I want timestamps on everything. And Sandra, she paused, whatever you documented about the hip flexor response today, I need that in the official record by end of day. Sandra was already writing. Yeah. The Wednesday meeting lasted 19 minutes. Amelia had prepared for it the way she used to prepare for difficult family conversations in the trauma bay, with facts arranged in order, language stripped of anything that could be characterized as emotional, and the particular stillness of someone who has decided they are not going to be moved. Holt walked in with a manila folder and a resident she hadn't met before, a young man named Dr. Falk, who was clearly there to take notes and who looked uncomfortable from the moment he sat down. Holt arranged the meeting with the structure of someone delivering a verdict. He reviewed the case, summarized the trajectory, and then said the word plateau 4 times in 3 minutes. He proposed reducing Amelia's therapy schedule from 5 days per week to 3. He framed it as a resource allocation decision consistent with her stage of recovery. He used the phrase realistic expectations twice. Amelia let him finish. Then she opened her own folder. She had printed Sandra's clinical notes from the past 6 weeks, time-stamped and signed. She had printed her own supplementary data, the notebook entries, cross-referenced against Sandra's official measurements, showing a consistent and documented upward trend. She had pulled the Halverson Institute's own published protocols for spinal cord injury rehabilitation, which stated clearly that schedule reductions required documented clinical evidence of plateau spanning a minimum of 4 consecutive weeks. She set the papers on the table between them. I'd like to see the clinical documentation for the plateau determination, she said. 4 consecutive weeks of flat or declining metrics, as required by your own protocols. Page 27. Holt looked at the papers, then at her. Then at Falk, who was no longer taking notes. The clinical assessment is a holistic judgment, he began. The protocol is specific, Amelia said. She turned to the page and slid it toward him. 4 weeks. Documented. I have 6 weeks of data showing the opposite. Before you reduce my schedule, I'd like to see the data that supports your assessment. There was a silence in that room that was different in quality from the silences that had come before it. It was the silence of a man who had been challenged in a language he thought he was the only one who spoke. I'll review the supporting documentation, Holt said finally. I'd like a response by Friday. He looked at her for a long moment. By Friday. He gathered his folder and left. Falk followed, carrying nothing, which suggested he had not managed to write anything down. Sandra was waiting in the hallway. Amelia came through the door and Sandra looked at her face and said, Well? He's going to delay, and then he's going to try again, Amelia said. But he can't do it without documentation he doesn't have, not anymore. And when he finds another angle? Amelia thought about Rex, who was currently in the K9 evaluation area with Marcus Reeve, waiting for a medical clearance that would determine where he spent the rest of his life. She thought about the intake form with her name in the second line. She thought about what it meant that a dog who had survived 4 combat deployments had crossed a room full of strangers and pressed his face into her lap and stayed there. Then we deal with it, she said. She wheeled toward the therapy bay. Behind her, from the direction of the K9 evaluation room, she heard a single sharp bark. Not alarmed, not trained. The kind of sound a dog makes when it wants you to know it's still there. She heard it. She kept moving. And in the administrative wing of the Halverson Rehabilitation Institute, in an office with a window that looked out over the parking lot and the strip of chain pharmacies, and the 2-lane road that carried more semis than passenger cars, Dr. Marcus Holt sat at his desk and read, for the first time, the documentation he had not thought she would produce, and understood that the ending he had already decided was no longer as certain as he'd believed. Holt's delay lasted exactly 6 days. He did not send a written response by Friday. He did not send one over the weekend. On Monday morning, Amelia arrived at Halverson at her usual time, signed in at the front desk, and found a printed memo in her intake folder informing her that her therapy schedule had been adjusted to 3 days per week, effective immediately, citing a clinical determination of functional plateau and resource optimization protocols. The memo was dated Friday. It had been placed in her folder sometime between Friday afternoon and Monday morning, which meant it had been delivered when she wasn't there to respond to it in person. She read it twice, folded it in half, put it in the front pocket of her bag beside her notebook. Then she wheeled herself to Bay 4 and did her session. Sandra didn't say anything when Amelia came in. She didn't have to. The look on her face when she saw Amelia's expression said everything that needed to be said, and they both understood that speaking about it in the open therapy bay, where voices carried and staff moved in and out, was not the right move. They worked through the full session in near silence, standing frame, resistance protocol, the lateral hip activation sequence Sandra had added after the previous week's response. Amelia pushed harder than she should have. Sandra let her because she understood the difference between productive anger and destructive anger, and what Amelia was doing with her body right now was the former. 40 minutes in, Sandra said quietly, "He backdated it. I know. That's not a clinical decision. That's a paper trail. I know that too." "Amelia." Sandra's hand stilled on her knee. "This is beyond what I can fight from inside the department. If he's backdating memos to avoid a response window, he's operating outside protocol. That means you need someone outside this facility." Amelia had been thinking the same thing since she'd read the memo in the lobby. She had been running through her options in the background of every rep, every hold, every measured breath, the way she used to think through triage protocols while her hands were busy with something else entirely. She had names in mind. She had known since Wednesday that Holt was not going to stop. The memo was confirmation, not surprise. What it changed was the timeline. "How long has he been doing this?" she asked. "With other patients, not me specifically." Sandra was quiet long enough that the answer was already clear. "I've had concerns before. I've flagged things internally. Nothing stuck." "Because it was internal." "Because it was internal." Amelia nodded once. She filed that away beside the memo and continued her session. Marcus Reeve was waiting near the lobby when she came out at 10:15. He had Rex on a short lead, sitting at his left heel with the patient stillness of a dog who has learned that waiting is part of the job. Rex's ears came up the moment Amelia's chair came through the door. His tail moved once, restrained and deliberate, which she was already learning was the dog's version of enthusiasm. "You have time?" Marcus asked. "For what?" He held up a thin stack of papers. "Rex's adoption paperwork. The canine coordinator says he can be processed this week if we have the adopter lined up. And the behavioral evaluation," he stopped. "He won't interact with anyone else. They tried 4 different assessors. He sat through all of it and didn't engage." Amelia looked at the dog. Rex looked back at her with the calm certainty of an animal who had already resolved this particular question and was simply waiting for the paperwork to catch up. "I live in a 1-bedroom apartment," she said. "I'm in a wheelchair. I can't walk him." "He doesn't need walking the way a civilian dog does. He needs purpose and proximity and—" Marcus paused. "He's been sleeping outside the door of the room they put him in at the facility house. Won't settle inside. The coordinator thinks he's looking for something." She already knew what he was looking for. "Send me the paperwork," she said. "I'll review it tonight." Marcus nodded. He didn't push it further, which she appreciated. He had the quality she associated with people who had spent time in genuinely high-stakes environments. The ability to say a necessary thing once and then trust the other person to carry it. Rex watched her go until she was through the outer doors. The independent patient advocate Amelia contacted was named Dorothea Marsh, and she came recommended by a former colleague who had navigated a hospital billing dispute 2 years prior. Marsh was 60, sharp-eyed, and ran her practice out of a 2-room office above a dry cleaning shop in downtown Millbrook. She had 17 years of experience in healthcare patient rights, a wall of continuing education certificates, and a manner that Amelia recognized immediately as the civilian equivalent of a trauma nurse in the middle of a resuscitation, direct, economical, and completely unimpressed by credentials that weren't backed by performance. She read through Amelia's documentation in silence, the clinical notes, the supplementary data, the Halverson protocols, the backdated memo. She read everything twice, which Amelia appreciated. People who read things twice were people who understood that details mattered. He didn't follow his own facility's protocol, Marsh said finally. No. And the backdating puts the decision outside your window to formally appeal within the department's standard timeline, which I believe was intentional. Marsh tapped the protocol document with one finger. Your assigned therapist? She's documented everything you've described? Yes. She's been consistent since week 1. Is she willing to go on record if this escalates to a formal complaint with the state medical board? Amelia had not yet asked Sandra that specific question. She had not wanted to put the weight of it on her before she knew whether it was necessary. I believe so. I haven't formally asked. Ask her today, Marsh said, because here's where you are. She sat back in her chair and folded her hands. What Holt has done is not illegal on its face. A physiatrist has broad discretion in treatment planning. But when that discretion is applied in violation of the facility's own written protocols, and when the documentation trail suggests the decision was made without proper evidentiary support, that's a reviewable action. The question is whether you want to pursue it internally, which, given that it's already failed once when Sandra flagged concerns, or externally. Externally, Amelia said without hesitation. Then we file a formal complaint with the Colorado Division of Regulatory Agencies, Medical Board Division. We attach everything you have. We request an independent clinical review of your case. Marsh paused. That process takes time, weeks, possibly months. In the meantime, Holt can still operate. He can still make decisions about your care. So I need something faster. You need something faster and something that builds the longer-term case simultaneously. Marsh looked at her. Do you know anyone with standing to request an independent specialist consultation? Someone outside Halverson who could review your case file and provide a second opinion that could be attached to a formal challenge. Amelia thought about it. She had not practiced in Colorado. Her professional network was largely in Oregon and largely in trauma, not rehabilitation medicine. But she knew people who knew people, and she had spent 12 years in a field where the right specialist was always one phone call away from someone who had their number. I can find someone, she said. Find them fast, Marsh said. Because the longer this memo sits in your file without a formal challenge, the more it becomes the baseline. Amelia thanked her, scheduled a follow-up, and wheeled herself back to her car in the parking lot of the dry cleaning strip mall. She sat for a moment with both hands in her lap, looking at the steering wheel of the modified vehicle she had learned to drive 6 months ago. The hand controls were second nature now. Most things were becoming second nature. That was the point. She called Sandra. I need to ask you something direct, she said when Sandra picked up. Okay. If this goes to the state medical board, if there's a formal complaint against Holt, are you willing to be on record? A pause. Not hesitation. Sandra was thinking it through, which was different. I flagged concerns twice before, Sandra said. Internal. Both times they went nowhere. If the external route is the one that actually gets reviewed, another pause. Yes, I'm willing. Thank you. Don't thank me yet. Holt's going to figure out what's happening. When he does, he's going to make things harder before they get easier. I know. Amelia, Sandra's voice dropped slightly. How are you actually doing? Not clinically. You. She thought about that question longer than she expected to. I'm tired, she said finally. But I've been tired before. It doesn't stop me. Sandra made a sound that was not quite a laugh. No, it really doesn't. The thing about Garrett Pellman was that he came back. Amelia had assumed the confrontation in the gym was a one-time event, the kind of boundary testing that happened occasionally in shared rehabilitation spaces and usually resolved itself when the tester realized the boundary was real. She had been wrong. Garrett Pellman was not a man who resolved things. He was a man who escalated them on a delay, the way certain infections present late, after you've already assumed the worst has passed. It happened on a Thursday, her second week of the reduced schedule. She was in the gym for one of her 3 allotted sessions, running the resistance protocol, when Garrett came in for his afternoon appointment. He had a new brace on his knee, which told her his surgery recovery was moving forward. He looked at her from across the room when he came through the door, and she saw in his face the particular expression of a man who has spent time nursing something small into something bigger. He waited until Sandra stepped out to pull equipment from the storage room. Then he crossed the gym and stopped 4 feet from her chair. "Heard you've been making noise about the doctors," he said. His voice was conversational, amused almost. "Filing complaints, getting lawyers involved." Amelia continued her rep. "Patient advocates aren't lawyers. Whatever they are. You know what that looks like to everyone else here? It looks like you can't accept the situation, like you're one of those patients who makes everything harder for everyone." He tilted his head. "The staff talks, you know. They all think you're doing too much, that you can't handle the reality." She finished the rep, set her hands in her lap, looked at him. "Did someone send you to tell me that, or did you come up with it yourself?" He blinked. "What?" "Because if you came up with it yourself, that's one thing. But if someone in this facility suggested to you, directly or indirectly, that having a conversation with me about dropping my complaint was a good idea, that's something I'd like to know about." Garrett's face went through several expressions quickly. Surprise, then irritation, then the particular blankness of a man who has just realized he may have stepped into something more consequential than he intended. "I'm just saying what people are thinking," he said, and his voice had lost some of its easy quality. "Then people can think it. Is there anything else?" He left. Amelia sat for a moment with her hands very still in her lap, running through what had just happened. Not emotionally, but analytically. Garrett Pellman was not a sophisticated man. He was not the type to come up with an approach like that on his own. He was the type to repeat things he'd heard, in the manner he'd heard them, without considering that the person on the receiving end might be able to hear the original source in the phrasing. She picked up her notebook and wrote down every word she could remember of the exchange. Time, date, witnesses. There were none, since Sandra had been out of the room, but she wrote Sandra absent, storage run, and the approximate duration. She wrote down his specific phrasing, making noise, getting lawyers involved, staff talks, can't handle the reality. Not the vocabulary of a post-surgical knee patient with a grudge, the vocabulary of someone who had been briefed. Sandra came back with a resistance band and a foam roller and stopped when she saw Amelia's face. "What happened?" Amelia held up the notebook. "He came back, and I think Holt sent him." Sandra read the notes. Her expression changed slowly, the way weather changes. Not all at once, but in a direction that became unmistakable. "We need to tell Marsh. Already planning on it." "Today, Amelia. Today." Marcus Reeve had been spending his days at Halverson longer than his evaluation appointment strictly required, which Amelia had noticed but not commented on. He said it was because Rex's transition paperwork was complicated, and that was true enough. What was also true was that he had taken to sitting in the lobby with coffee from the cart near the entrance, and that Rex was better behaved in the building when Marcus was present, and that Marcus had, without quite announcing it, begun showing up at approximately the time Amelia's sessions ended. She did not examine this too closely. She had other things to examine. On the Thursday after the Garrett incident, she found Marcus in his usual lobby chair and said, "I need to ask you something." He set down his cup. "Okay." "The intake form, with my name on it. Who has access to Rex's military service records?" Marcus frowned slightly. "The K-9 Unit Command, Veteran Affairs, the Adoption Program Coordinator." "Why?" "Because if Holt finds out that the dog who broke protocol to cross a room and sit on my lap has documentation linking him directly to me, and that documentation exists in a military record, he might try to use it, frame it as a distraction, an emotional attachment that compromises my ability to assess my own progress realistically." Marcus was quiet for a moment. "That's a stretch." "He backdated a memo to cut my therapy sessions. How much of a stretch is it?" He considered that. "The records are protected under military privacy provisions. He'd have to go through formal channels to get them." "But they're not sealed." "No, they're not sealed." Amelia nodded. "I just need to know the landscape." "Is there anything I can do?" he asked. He said it the way people say things when they actually mean them, without flourish, without the slight performative quality that attaches to offers made for social reasons rather than practical ones. She thought about it genuinely. "Maybe. Do you know anyone in the veterans medical advocacy space? Someone with standing who's dealt with institutional resistance to rehabilitation access before?" "I know several people," he said. "One in particular who dealt with a VA facility blocking continued therapy for a service member's TBI recovery. She went through the state medical board. Took 8 months, but she won." 8 months is too long for my current situation, but the contact might be useful for what comes next. She paused. Can you make an introduction? Tonight, he said. Rex, who had been lying at Marcus's feet, lifted his head and looked at Amelia with the focused attention he reserved for moments when she was making decisions. She didn't know how he read it, some combination of her voice and posture and the particular quality of her stillness when she was working through something serious, but he consistently tracked the moments that mattered. Good boy, she said quietly. His tail moved once. The independent specialist consult came through on a Tuesday, 12 days after Amelia had left Dorothea Marsh's office, with a list of action items and a clearer sense of the terrain she was crossing. The specialist's name was Dr. Yolanda Ferris, out of the University of Denver's Spinal Cord Injury Program, a physiatrist who had published extensively on functional recovery timelines and whose name Amelia had found through a contact in the Oregon rehabilitation medicine community, who described her as someone who did not tolerate sloppy assessments. Ferris reviewed Amelia's complete file remotely, Sandra's clinical notes, the supplementary data, the Halverson protocols, and the backdated memo, and then scheduled a video call with Amelia for a Wednesday afternoon. The call lasted 40 minutes. Ferris asked questions the way Amelia asked questions, efficiently, without preamble, with the specific focus of someone who already knows what they're looking for and just needs to verify it's there. At the end of the call, Ferris said, "Your recovery trajectory is not consistent with a plateau determination. The data Sandra Okafor has documented is clear. You're showing progressive neurological recruitment, partial but real and measurable. The decision to reduce your therapy schedule is not supported by the clinical evidence in your file." Would you put that in writing? Amelia asked. I'll have a formal written assessment to you by Friday. And if this goes to a state board review? Ferris paused for just a moment, the pause of someone deciding something. I'd testify to it. Amelia thanked her and ended the call. She sat in her apartment in the quiet of the late afternoon with Rex on the floor beside her chair and the printed clinical notes spread across the table in front of her. Rex had been with her for 9 days. He had figured out the apartment with the quiet practicality of a working dog adapting to new terrain, identified the spaces wide enough for her chair, learned to stay clear of the footrests without being told, understood that the bathroom was a logistic situation requiring patience, and had settled into a routine that matched hers with an accuracy that felt uncanny and was probably just the result of a dog who paid very close attention. He was watching her now. Friday, she said to him. Sorry, Ferris sends the assessment Friday. Then Marsh files the complaint Monday. Rex's ear moved. I know. She looked at the papers. Holt's going to find out before we file. Someone in this building will tell him. They always do. She was right about that. On Thursday morning, one day before Ferris's written assessment was due, Amelia arrived at Halverson for her session and found that Sandra had been pulled from her schedule. Not removed, reassigned, temporarily, to cover for a therapist who had called out sick, which was a real and non-suspicious reason that could not be challenged. Except that the therapist who had called out sick had, according to the aide Amelia spoke with quietly near the equipment closet, never called out before in 2 years of employment. And the replacement assigned to cover Amelia's session was a staff therapist she had never worked with, who had no familiarity with her protocol, and who spent the first 10 minutes of the session reviewing her baseline chart, the outdated one, not Sandra's updated documentation. Amelia corrected him 3 times. He made notes. He was not unkind. He was simply wrong about where she was, and she did not have the energy to resent him for it. After the session, she sat in the parking lot with her phone and called Sandra. They pulled you, she said. I know. I found out this morning. Sandra's voice had a quality in it that Amelia had not heard before, not fear, but the sound of someone who has been pushed to a threshold they didn't expect to reach. Amelia, he knows about Ferris. The words settled into the parking lot air. How? I don't know. But Holt called me into his office this morning before the schedule change and asked me, directly, whether I had been in contact with any outside specialists regarding active patient cases. He phrased it as a general policy reminder. It wasn't general. Amelia looked at the building through the windshield, the beige brick, the automatic doors, the ramp that was technically compliant and practically inconvenient. Did he threaten you? She asked. Not in words. In what then? He reminded me, Sandra said carefully, that clinical documentation standards are subject to supervisory review, and that any documentation generated outside the scope of a patient's official treatment plan, including supplementary therapist notes, could be considered outside sanctioned practice boundaries. A silence. "He's threatening to challenge your notes," Amelia said. "He's threatening to make them disappear." Amelia put her hand on the steering wheel, not gripping it, just resting there, a point of contact with something solid while she worked through the information. Rex, in the back seat, shifted and put his chin on the center console near her elbow. "Sandra." Her voice was steady. "How many copies of your documentation exist right now?" "I keep the originals at home. I always have since the first time I tried to flag something internally." "Does Marsh have copies?" "You gave her copies." "Right." She exhaled slowly. "So if he challenges the notes in the system, there are still originals outside the system." "Then he can't make them disappear," Amelia said. "He can only make them inconvenient, which is not the same thing." Sandra was quiet for a moment. Then, "Ferris's assessment comes tomorrow." "Tomorrow." "And when it does," Amelia said, "we stop being quiet about it." She put the car in reverse. Behind her, from somewhere in the back seat, Rex made a low sound. Not alarmed, not trained, just present, just there. She pulled out of the Halverson parking lot and drove toward the strip mall and the dry cleaning shop and the 2 rooms above it where Dorothea Marsh kept her files and her wall of certificates and her 17 years of knowing exactly how to take something that had been made inconvenient and turn it into something that could not be ignored. And in his office on the 2nd floor of the Halverson Rehabilitation Institute, Dr. Marcus Holt sat at his desk and opened his email and found, already waiting for him, a message from the Colorado Division of Regulatory Agencies, acknowledging receipt of a preliminary notice of formal complaint, filed not Monday, as he had apparently calculated, but the previous afternoon, the moment Amelia had understood that he already knew about Ferris. She had not waited. She had moved first, and the ground that Holt had believed was solid under his feet had just shifted in a way he had not expected, because the woman he had decided was finished had just proved for the second time that she had been paying attention to everything, including him. The acknowledgement email from the Colorado Division of Regulatory Agencies was 3 sentences long and entirely bureaucratic in tone, but Dorothea Marsh had printed it, dated it, and added it to Amelia's file with the particular satisfaction of someone who understood that paper trails were their own form of leverage. "He'll receive his copy within 72 hours, Marsh said, on the phone Thursday evening. "Standard notification protocol. He'll know the complaint is formal, he'll know the scope, and he'll know that any subsequent actions he takes regarding your care will be reviewed in that context." "Meaning, if he tries to cut anything else, it becomes part of the record." "Yes." Amelia was at her kitchen table, Rex at her feet, the Ferris assessment, open on her laptop. Still unfinished, still coming tomorrow, but she had Ferris's verbal summary from Wednesday's call typed out and attached to her own documentation. She had organized everything into a single folder: clinical notes, supplementary data, the backdated memo, the state protocols, Ferris's verbal summary, the acknowledgement email, and the notes from the Garrett Pellman conversation, which she had submitted to Marsh with the caveat that she could not prove the source of his talking points, but that the language pattern was worth preserving. "What's the timeline from here?" she asked. "The board will assign a case reviewer within 10 business days. The reviewer contacts the facility, requests the patient file, and all relevant documentation. Halverson has 30 days to respond. After that, the reviewer can request additional information, convene a panel, or, in cases where they identify a potential ongoing harm to the patient, expedite the process." "How do we make them identify ongoing harm?" "Ferris's written assessment," Marsh said. "If an independent specialist with her credentials is willing to state in writing that the current reduced schedule is medically unjustified and that the delay in treatment is causing quantifiable harm to your recovery trajectory, the board has grounds to expedite." She said she'd testify to it. "Then we build around that. Get me her assessment the moment it arrives." After she hung up, Amelia sat in the kitchen quiet for a while. Rex shifted and put his head on her foot, both paws forward, chin resting on her right instep, which he had taken to doing in the evenings as a kind of anchor. She had read that working dogs sometimes did this, maintained contact as a form of vigilance, She didn't know if that was what he was doing or if he simply found the position comfortable, but either way she had stopped moving her foot when he did it. She looked at the apartment. The modified shower grab bar. The lowered countertop on the left side of the kitchen that the previous tenant had installed for a different reason, and that happened to work for her. The ramp her brother had built over the front step when she moved in, imperfect and slightly off-center but solid. Nothing in the apartment was perfect. Everything in it worked. She thought about that for a long time before she went to bed. Ferris's written assessment arrived at 9:47 on Friday morning, not the afternoon, which told Amelia that Ferris had worked on it Thursday night. It was 6 pages, single-spaced, structured with the precision of a document intended to be read by people who made formal decisions. It opened with a summary of her credentials, moved through a methodical review of every metric in Amelia's clinical file, and concluded with 3 paragraphs that Amelia read twice and then forwarded to Marsh without comment because the document spoke entirely for itself. The conclusion stated in formal clinical language that the reduction of Amelia Voss's therapy schedule from 5 to 3 sessions per week was not supported by the documented evidence of her recovery trajectory, that the assessment methodology used to justify the reduction did not meet the standard of care outlined in both Halverson's own protocols and the Colorado State Guidelines for Spinal Cord Injury Rehabilitation Management, and that the continuation of the reduced schedule posed a measurable risk of impeding neurological recovery during a window of documented plasticity that, in incomplete spinal cord injuries, was both finite and clinically significant. Finite and clinically significant. Amelia underlined it. Then she forwarded the document to Marsh and called Sandra. "Ferris came through," she said. Sandra exhaled audibly. "How clear is it?" "Clear enough that Marsh called me back within 20 minutes of receiving it." "What did she say?" "She said we file for expedited review and we request an emergency independent clinical assessment at the facility level, meaning someone comes to Halverson, reviews the file in person, and makes a recommendation that the director can't ignore. Can they do that? With Ferris's documentation, yes. The board has the authority to mandate an independent assessment if there's credentialed clinical evidence of ongoing patient harm. Ferris gave them that evidence." A pause. "Holt is going to know today. Someone in administration will tell him the moment the board contacts the facility. He already knows the complaint was filed. He's known since yesterday. Knowing it was filed and knowing Ferris put 6 pages of clinical analysis behind it are 2 different things." She was right about that. Amelia had been thinking about it since she forwarded the document. The specific difference between a complaint that could be weathered by institutional inertia and a complaint backed by a published specialist's formal written assessment. The first could be delayed and minimized. The second required an actual response. "When does he find out?" Sandra asked. "The board notifies the facility director first. Director will almost certainly tell Holt. Could be today, could be Monday. Then we have a window." "We have a window," Amelia agreed, "and I plan to use it." The window lasted until Monday afternoon. On Saturday and Sunday, Amelia worked at her kitchen table, organizing the complete evidentiary package with the same systematic efficiency she had applied to trauma documentation. Everything dated, sourced, cross-referenced. Marcus Reeve came by Saturday evening with takeout from a Thai place he'd found near his temporary housing, which Amelia had not asked for, but which she found herself grateful for in a way that was difficult to articulate. He set the containers on her kitchen table without making it a production and ate with the same economy of motion he brought to everything else. Rex spent the meal dividing his attention evenly between both of them, which Marcus observed with an expression Amelia couldn't quite categorize. "He's decided you're his person," Marcus said, watching Rex track Amelia's hand from the container to her mouth. "He does that. Pick someone and then it's done." "He picked you for 9 years. He worked with me. That's different." He paused. "He searched for you." She didn't have a response to that, so she didn't try to make one. She ate her food and Rex eventually settled with his head in her lap, and Marcus told her at some point about the contact he'd mentioned, the veterans advocate who had navigated the VA facility dispute. And they talked through what was useful in that case and what wasn't, which was a practical conversation and a necessary one, and also, she noticed distantly, the longest she had talked to anyone who wasn't Sandra or Marsh in several weeks. On Monday morning, she arrived at Halverson at 8 for her first session of her reduced 3-day week. The replacement therapist, whose name was Kevin and who was not unkind, had clearly been briefed by Sandra at some point over the weekend because he had the updated protocol in hand when she arrived and ran the session competently, if without the particular attunement Sandra brought to it. Sandra herself was not in the building. She was scheduled to return Tuesday. The board's formal notification reached Halverson's administrative director, a woman named Constance Webb, sometime Monday morning. Webb was 60, precise, and had been running Halverson's administrative operations for 11 years. Amelia had spoken to her exactly once, briefly, at intake. She was not a warm woman, but she was a careful one, which meant that when a state medical board notification arrived indicating a formal complaint and a request for expedited review backed by a credentialed specialist's assessment, she did not minimize it. Amelia was in the middle of her session, standing frame protocol, 12 minutes in, when she was told that Webb wanted to see her at 11. She finished her session, then she went. Webb's office was on the second floor, which required the elevator. The office itself was organized and impersonal, with the specific aesthetic of someone who kept their professional life entirely separate from any indication of interior experience. Webb was already seated when Amelia came in, and there was a second chair across from the desk and a small space beside it that was clearly intended for a wheelchair, which told Amelia that Webb had thought about this meeting before it happened. "Ms. Voss," Webb said, "I appreciate you coming up." "Of course." Webb had a folder on her desk. Amelia recognized the color, Halverson's internal case file format. "I want to be straightforward with you. The facility has received formal notification of a state board complaint regarding your case. I've reviewed the notification and the documentation attached to it, including Dr. Ferris's assessment. All right? I want you to know that we take this seriously." Webb's tone was careful, the tone of someone managing exposure, which was honest in its own way. "I've asked Dr. Holt for a formal response to Dr. Ferris's findings. I've also—" She paused. "I've requested that an internal review panel convene this week to assess whether the schedule modification was consistent with our own protocols." Amelia kept her face neutral. "I appreciate that. I want to ask you directly, is there anything you need in the immediate term while the review is pending?" There were several things she could say here. She chose the one that was most precise. "I need my sessions restored to the original 5-day schedule pending the outcome of the review. The clinical justification for reducing them has been formally contested by an independent specialist. Maintaining the reduction while that contest is unresolved is, as Dr. Ferris's assessment notes, potentially causing measurable harm." Webb looked at her for a moment. "I'll speak with Dr. Holt today. Appreciate a decision by tomorrow morning." A pause. "I'll do what I can." Amelia thanked her and went back down in the elevator. In the lobby, she sat for a moment near the windows, the same windows she had wheeled past every morning for 11 weeks, and took stock of what had just happened. Webb was not an ally. She was an administrator managing liability. But liability management and patient advocacy occasionally arrived at the same destination, and Amelia had been in enough institutional environments to know when to stop fighting and let the institution's own self-interest carry the weight. She pulled out her phone and texted Marsh, "Webb is convening internal review. Asked Holt for formal response to Ferris. May restore sessions preemptively." Marsh responded in under 4 minutes. "Good. Don't let them slow walk it. If sessions aren't restored by Wednesday, we request emergency injunction through the board." She put her phone away. Rex was not with her today. He was at her apartment, which was his first full day there alone, and she had spent 20 minutes that morning making sure he had water and a clear path to his bed, and the specific blanket she'd put on the floor near the sliding door where the afternoon light came in. She had not expected to be anxious about leaving him. She was a little anxious about leaving him. She sent Marcus a text asking if he could check on him at noon. He responded with a single word, "Already planned." She did not examine how that made her feel. She had other things to examine. Holt's formal response to Webb came Tuesday morning, and Sandra, back on her regular schedule, restored without explanation, found out its contents through the particular information network that exists in every small medical facility, which runs entirely on proximity and shared spaces, and the fact that people who work together cannot entirely avoid each other. "He's challenging Ferris's methodology," Sandra said, in the hallway outside Bay 4, her voice low. "He's saying she conducted a remote review without examining you in person, and that her conclusions are therefore outside standard clinical assessment protocols. Amelia absorbed this. Is he wrong? Technically, a remote view has limitations, but Ferris reviewed every document in your file. Her conclusions are based on documented metrics, not physical assessment. Holt's own assessment involved 2 in-person meetings lasting 12 minutes combined, and his conclusions contradicted 6 weeks of Sandra's clinical documentation. She stopped. So is he wrong? No. Is his objection hypocritical? Substantially. He's buying time. He's buying time, and Webb... Sandra paused. Webb didn't restore the sessions this morning. The word Wednesday entered the room between them without being spoken. The deadline Marsh had set. Then we need Ferris in person, Amelia said. What? If Holt's objection is that she conducted a remote review, we remove the objection. We bring Ferris here, in person. She examines me directly, documents it, and submits an amended assessment. His entire argument collapses. Sandra looked at her. Can you get Ferris here? I don't know, but I'm going to ask. She called Ferris from the parking lot at lunchtime. The call went to voicemail. She left a message that was brief and specific. The situation, the objection, the request, the timeline. And then she sat in her car with both hands on the wheel and waited. Ferris called back at 2:15. I have a conference Thursday, she said. I can be at Halverson Wednesday afternoon. Late, 4 o'clock. That works? I'll need access to the full physical therapy suite and someone who knows your current protocol in the room. Sandra Okafor, she'll be there. And I'll need your file from intake. Everything. Not the version Webb's office sends me. Your version. The complete documentation. I'll have it ready. Amelia. Ferris paused. I want to be clear. If I come in person and my physical assessment contradicts Holt's plateau determination, I'm going to say so in writing and I'm going to say it specifically. No hedging. That's all I need. All right, Wednesday at 4. She texted Marsh immediately. Marsh's response was 6 words. Tell me the moment she leaves. Wednesday at 4, Ferris arrived at Halverson in a gray coat with a leather bag and the specific manner of someone who did not require anyone to make her comfortable. She was 52, compact, with close-cropped hair, and the kind of directness in her eyes that Amelia recognized from the best clinicians she'd worked alongside. Not arrogance, but the settled certainty of someone who has spent long enough in a field to know exactly what they're looking at. Holt was not in the building. Amelia had expected him to be present, had prepared herself for his presence, and his absence was more complicated than his attendance would have been. It suggested either that he had been told to stay away by Webb, which meant Webb was managing the situation more actively than she had indicated, or that he had chosen absence as a strategic posture, which meant he was preparing a different kind of response. She filed the observation and moved on. The physical assessment took 90 minutes. Ferris worked through Amelia's full functional presentation, manual muscle testing, sensation mapping, neurological reflex assessment, voluntary activation sequences, with a systematic thoroughness that Amelia found, despite everything, clarifying. It was the first time since her intake that she had been assessed by someone whose full attention was on what her body was actually doing rather than on what it was supposed to be doing based on a trajectory someone else had decided in advance. Ferris found things. The left hip flexor response Sandra had documented was real and measurable. The sensation change below the injury level was real. And midway through the session, 47 minutes in, during a voluntary activation sequence. Sequence Ferris had added on the basis of what she was seeing in the earlier testing. Amelia's right ankle moved, not a reflex, not a compensatory motion from a proximal muscle group, a voluntary dorsiflexion, small and imprecise and immediately fatigued. But Ferris's hand was on the joint and Sandra was watching from the right position to see the movement, and both of them went completely still at exactly the same moment. Do it again, Ferris said. Her voice was even. Amelia focused. The neural pathway was new and thin, and she could feel it the way you feel a word on the tip of your tongue. The sense of something almost resolved, almost accessible. She pushed into the effort the way she had learned to push into everything since the accident. Not hard, but deep. Sustained and specific. The ankle moved again, smaller this time because the first effort had cost something. But it moved. I'm documenting this as voluntary, Ferris said. She looked at Sandra. You saw it. I saw it, Sandra said. There was something in her voice that was not clinical, a quality that broke through the professional surface for just a moment and then went back under. Amelia felt something in her chest that she did not have language for and did not try to name. She pressed her lips together and breathed through it and kept her hand still in her lap and let the moment be what it was without performing it for anyone. That is the opposite of a plateau, Ferris said. She was already making notes. That is active neurological recruitment in a muscle group that wasn't firing at your intake. That is measurable progress during a window when your sessions were reduced. She wrote without stopping. He cut your therapy while your nervous system was doing this. No one said anything else for a moment. Then Sandra said quietly, "We need witnesses for the documentation." Ferris looked up. "Who's in this building right now who has standing to witness a clinical finding?" "Kevin's in the main gym. He's staff. He covered Amelia's sessions while I was reassigned." "Get him." Sandra went. She came back with Kevin, who was clearly not prepared for what he walked into. The physical therapy suite arranged for an assessment, Ferris with her documentation, Amelia in the standing frame, and who looked at all of it and then at Amelia's face and said, "What do you need me to do?" "Stand there," Ferris said. "Watch. When I document what I'm about to document, I'm going to ask if you confirm that you were present. That's all." Kevin looked at Amelia. She gave him a single nod. He crossed his arms and stayed. Ferris ran the ankle activation sequence 2 more times. Both produced visible voluntary movement, diminishing with each effort, as expected, because new neural pathways exhausted quickly. She documented all 3 instances with timestamps, described the motion characteristics, noted the confirmation from Sandra Okafor and Kevin Marsh, who, they discovered, shared a last name with Dorothea Marsh and was entirely unrelated, which was the kind of small absurd coincidence that real situations produced and fiction avoided. When she was finished, Ferris closed her documentation folder and looked at Amelia with the particular expression of a specialist who has found something they already suspected but needed to confirm. "I'm going to submit an amended assessment by Friday," she said. "It will include today's findings. The voluntary dorsiflexion, the hip flexor documentation, the sensation mapping, all of it." She paused. "And I'm going to specifically address Holt's objection about remote assessment in the cover letter. He wanted in-person. He has in-person." "Thank you," Amelia said. "Don't thank me. The data did this. I just came to read it." She picked up her bag. "Get some sleep. You're going to need to be sharp for what comes next." She left. Kevin left shortly after, with the quietly dazed expression of someone who has witnessed something they'll be thinking about for a while. Sandra stayed, entering notes into the official system with timestamps and witness confirmations, moving with the deliberate efficiency of someone who understood that the documentation was now as important as the finding itself. Amelia stayed in the standing frame, not because she needed to, but because she didn't want to leave yet. She looked at her right foot. She thought about the 4 combat deployments Rex had survived. She thought about the roadside in eastern Afghanistan and a dog who had kept searching for 5 years and a 12-minute intake assessment that had tried to decide her ending before she'd had the chance to write it. She thought about the ankle movement. Small, imprecise, immediately fatigued, real. She had her phone out and was texting Marsh the 6 words she'd promised when the door to the physical therapy suite opened. She expected Kevin, returning for something he'd forgotten. She expected a staff aide. She expected nothing significant, because the significant things had already happened today. It was Holt. I was in his coat, just arrived, or just leaving. And he had the particular stillness of someone who has walked into a room and immediately understood the situation more clearly than he had expected to. His eyes went to Ferris's chair, still pulled out from the assessment position, to Sandra at the documentation terminal, to Amelia in the standing frame with her phone in her hand. He looked at her right foot. She watched him understand. "I didn't know Dr. Ferris would be conducting an in-person assessment today," he said. His voice was controlled. "No," Amelia said. "You weren't meant to." Holt's jaw tightened slightly, the only visible indication of the thing happening behind his expression. He looked at Sandra, who continued entering notes without looking up. He looked at Amelia's documentation folder, visible on the edge of the equipment table. "Constance Webb is expecting a report from Dr. Ferris," he said. "There are protocols for how outside consultants interface with—" "Dr. Ferris will submit directly to the State Board Review Panel," Amelia said, "with a copy to Webb, per board protocol. It's all standard." Another silence. Ms. Voss? He stopped. Started again. There was something in his face that Amelia had not seen there before. Not quite what she had expected, not the clean effect of someone maintaining authority, but something more turbulent and harder to read. Whatever you think happened with your case, I don't think anything, she said. I have documentation. He looked at her for a long moment. Then at her right foot, still in the standing frame, 8 weeks of reduced therapy and active neural recruitment happening in a body. Everyone in this room except him had been paying attention to. I'll be reviewing Dr. Ferris's assessment when it arrives, he said finally. I know you will, Amelia said. He left. Sandra did not move from the terminal. She kept entering notes. After a moment, she said without looking up, he saw the standing frame. He saw you upright. Yes. He knows what the assessment is going to say. Yes. Amelia. Sandra stopped typing. She turned around. His face, when he looked at your foot, did you see that? She had. She had filed it away to examine later when she had more space to consider what it meant. Not guilt. She wasn't certain guilt was part of Holt's emotional architecture, but something adjacent to it. The specific expression of a person who has constructed a version of reality and has just seen, in a physical standing frame in a rehabilitation suite they had tried to empty, the evidence that their version was wrong. I saw it, she said. What do you want to do? Amelia looked at her right foot. She thought about Ferris's amended assessment coming Friday. She thought about the state board reviewer coming within 10 days. She thought about the formal review panel that Webb had convened, which would need to meet before the end of the week if it was going to stay on the board's expedited timeline. She thought about 12 minutes. 2 intake conversations, 12 minutes combined, in which a man had decided she had a ceiling and stopped looking for evidence to the contrary. I want to be at that review panel, she said, in person, with Sandra, with Ferris's assessment, and with every piece of documentation in that folder. And I want Holt to present his clinical evidence, the actual data, not the conclusions. And I want to ask him, in front of the panel, to show me where the plateau is. She lowered herself from the standing frame and settled back into her chair. Because it's not there, she said, and he knows it now. The lights in the therapy suite were still on. Sandra's documentation was still uploading. Outside in the hallway, the Halverson Rehabilitation Institute continued its regular operations. Patients moving between bays, staff tracking schedules, the particular hum of an institution that had not yet fully reckoned with the thing that had just happened inside one of its rooms. Amelia's phone buzzed. Marsh, responding to the 6 words she'd sent. Voluntary dorsiflexion. Witnessed, documented. Marsh's reply arrived in 3 seconds flat. Schedule the panel. We're done waiting. And somewhere in the administrative wing of the 2nd floor, in an office with a window looking out over the parking lot, the email notification that would arrive in Holt's inbox sometime in the next hour. Formal panel scheduling, expedited state board review, independent specialists' in-person findings, was already on its way. The panel convened on a Friday, which was not the day Amelia had expected, but was the day Webb had available. And she had learned enough about institutional momentum to understand that when it started moving in your direction, you did not argue with the schedule. The review room was on the 2nd floor, 3 doors down from Holt's office, which was either a coincidence or a deliberate choice by Webb that Amelia decided not to read too much into. It was a conference room, oval table, 8 chairs, a wall-mounted screen for document display, windows that looked out over the same parking lot, and the same strip of pharmacies she had been looking at for 12 weeks. The familiarity of the view was almost funny. Marsh was with her. She had arrived at the building 40 minutes early, found Amelia in the lobby, and reviewed the documentation order one final time with the focused efficiency of someone who had done this enough times to know exactly where things went wrong and was determined to prevent it. Ferris had submitted her amended assessment Thursday evening. 6 pages became 9. With the voluntary dorsiflexion findings added in full, and Holt's remote review objection addressed directly in an opening paragraph that was, by clinical writing standards, quietly devastating. Sandra was in the building, but not in the panel room. She would be called as a clinical witness if needed, and the decision about whether to call her had been made by Marsh. Hold her back until the point of maximum necessity, because a witness deployed too early loses the weight of their entrance. Marcus Reeve was in the lobby. He had not been asked to come. He had simply come, the way he came to most things. Without announcement, without making it a statement, available if needed and unobtrusive if not. Rex was with him, because Rex was always with him when they were away from Amelia's apartment, and because Marcus had figured out, without Amelia explaining it, that Rex's documented connection to her case was a fact that existed in the record and might be relevant to what happened today. Amelia did not say anything about this when she saw them. She looked at Marcus, and he gave her a single nod. She went upstairs. The panel consisted of 4 people: Constance Webb, who chaired it, a physician named Dr. Roland Fitch from Halverson's Internal Quality Assurance Division, who Amelia had never met, and whose expression in the first 30 seconds told her he had read the file. An external representative from the Colorado Rehabilitation Medicine Licensing Board named Patricia Eng, who was there in an observer capacity as part of the expedited review process, and a patient rights coordinator named Deborah Salas, whose presence Amelia had not anticipated, and who, she would later understand, had been added to the panel at Eng's request as standard practice when a formal board complaint involved an active patient. Holt was already seated when Amelia came in. He was on the opposite side of the table, slightly toward the far end, with a folder in front of him, and the particular posture of a man who has arranged his body into a shape that communicates composure and has not quite managed it. He looked at her when she entered. She looked back. Neither of them said anything. Webb opened the panel at 9:15. This is a formal clinical review convened pursuant to a patient complaint filed with the Colorado Division of Regulatory Agencies, she said, and pursuant to this facility's own quality assurance protocols regarding modification of active rehabilitation plans. The purpose of this panel is to review the clinical basis for the schedule modification in the case of patient Amelia Voss, to assess that basis in light of independent specialist findings, and to determine appropriate next steps. She looked around the table. This is not a disciplinary hearing, it is a clinical review. The findings will be documented and submitted to the state board reviewer as part of the formal complaint response. Fitch had his copy of Ferris's assessment open. Eng had a tablet. Salas had a legal pad. Holt had his folder. Dr. Holt, Webb said, we'll begin with you presenting the clinical rationale for the schedule modification. He opened his folder. He had prepared. She could see that. He had organized his materials and prepared a verbal summary, and for the first 60 seconds of his presentation, he sounded like a man who had decided he was still in control of the room. He cited her intake baseline, her early trajectory metrics, the rate of change in weeks 6 through 8, and used the word plateau 3 times, which Amelia noted with the same quiet precision she had noted every other use of it. Then Fitch said, "Can you walk me through the 4-week documentation requirement per Protocol 27? Holt paused. A small pause. The kind that is only visible to people who are watching for it. The protocol establishes general guidelines for documentation. It's specific, Fitch said. He had a flat procedural quality to his voice that Amelia recognized as useful. 4 consecutive weeks of flat or declining metrics, documented in the clinical record, are required before a schedule reduction is implemented. I've reviewed the clinical notes in this case. I'm not seeing 4 weeks of flat metrics. I'm seeing 6 weeks of positive trend." He looked up. "Can you show me the 4 weeks?" Another pause. Longer. "The clinical assessment encompasses more than numeric metrics," Holt said. "It includes qualitative judgment regarding the patient's overall trajectory and the realistic potential for—" "The protocol is specific," Fitch said again. Webb looked at Holt. The look of a person who is managing a situation and is not enjoying it. Eng said quietly, "Dr. Holt, do you have documentation of a 4-week plateau consistent with the facility's own protocol? The assessment was made on the basis of clinical judgment. That's not what I asked." The room was quiet. The particular quiet of a room in which a question has been asked and the absence of an answer has become the answer. Holt set his pen down on his folder. Something in his posture shifted, not dramatically, not a collapse, but a small and irreversible settling, like the first visible sign of something structural giving way beneath a surface that had looked intact. "I will need to review my documentation to provide a precise—" "You don't have it," Amelia said. Every head at the table turned to her. Marsh put one hand on her forearm. Not a warning, just contact. "I'm not saying that to be antagonistic," Amelia said. She kept her voice the same way she kept her voice during difficult conversations in the trauma bay. Level, because levelness was not weakness, and she needed them to hear the information, not the emotion underneath it. I'm saying it because I've reviewed my complete clinical file. I know what's in it. The 4-week documentation required by your own protocol does not exist, because the plateau determination was made in advance of the evidence required to support it. The schedule was reduced first. The justification was constructed after. The room absorbed this. Fitch looked at Webb. Webb looked at Holt. Holt picked up his pen, set it down again. The assessment process. Dr. Holt. Webb's voice had changed. Not louder, quieter, which in Amelia's experience was always the more significant direction. Do you have the documentation or not? A silence that lasted long enough to become its own kind of statement. Not in the form the protocol specifies, he said, finally. The panel recessed at 10:45. Amelia went down to the lobby. She wasn't required to stay in the building during the recess, but she wasn't going to leave either. Not with the room still unresolved, not when she could see from Webb's face that decisions were being made that she needed to be available to respond to. She found Marcus and Rex near the windows. Rex came to her immediately, and she put her hand on his head and he stayed against her leg with his whole weight. "How's it going?" Marcus asked. "He couldn't produce the documentation," she said. "Fitch caught it inside the first 10 minutes. Marcus was quiet for a moment. "And Ferris's assessment?" Eng had it on her tablet. She was referencing it while Holt was talking. She looked at the elevator door. "Webb knows. She's known since the board notification. What's happening upstairs right now isn't a deliberation. It's a conversation about how much of this stays internal and how much goes to the board reviewer." "Can they keep it internal?" "Ong is sitting in that room as the board's representative. Nothing that happens stays internal." She paused. "Which Webb knows. Which means she's managing a transition, not a defense." He looked at her. "You're very calm." "I've been doing triage for 12 years. You learn what a stable patient looks like even when nothing looks stable." She scratched Rex's ear. "I'm not stable. I'm performing stable." He made a sound that was almost a laugh. "Fair enough. Thank you for being here," she said. "You didn't have to." Rex needed the walk. She looked at the dog. The dog looked at her. "Sure," she said. She went back upstairs. The second half of the panel lasted 90 minutes, and the landscape of it was different in a way that was immediately apparent when Amelia returned to the room. Webb's posture had changed. Fitch was more deliberate. Ung had moved from observer to active questioner. And Holt was now seated in the particular way of a man who understands that the room has reorganized around him without his participation. Sandra was called in at 11:20. She came in with her documentation organized in a binder. She had clearly prepared herself, without anyone asking her to, and she sat down with the calm of someone who had been waiting for this specific moment for longer than today. Ung asked her to describe the voluntary dorsiflexion finding from Wednesday's assessment. Sandra described it, precisely, clinically, with reference to the timestamp documentation and Kevin's witness confirmation. She described the hip flexor response. She described the sensation changes below injury level. She described 6 weeks of documented positive trend and the session she had run Thursday, which had shown the same voluntary ankle movement, slightly stronger on the second day. Slightly stronger. Amelia had not known about Thursday's session. She hadn't been there. It had been Kevin running her reduced schedule slot. But Sandra had documented it, and she was saying it now. And Amelia pressed her hands flat on the table and breathed through the thing that moved through her chest when she heard it. "And in your professional assessment," Ung said, "is the current 3-day schedule consistent with the clinical picture you've described?" "No," Sandra said. "The neural recruitment I'm documenting is in an active phase. Reducing session frequency during this window reduces the stimulus available for consolidation of new pathways. It's the opposite of what the evidence recommends." "Thank you." Eng made a note. Holt had not spoken in 20 minutes. Webb had not asked him to. He was sitting with his folder closed and his hands on the table and his face arranged in the expression of a man who has recognized the position he is in and is now deciding what version of the next hour he can still control. He chose intervention. "I want to be on record," he said, "as stating that my clinical judgment in this case was made in good faith, based on my assessment of the patient's trajectory and the resources available for... Good faith isn't the question, Fitch said. He was still reading something. He didn't look up. Protocol compliance is the question, and good faith doesn't substitute for the 4-week documentation requirement. I understand that. I'm saying, Dr. Holt. Ung set down her tablet. She looked at him with the level attention of someone who has sat in many rooms like this one and is not impressed by the architecture of any of them. The independent specialist's assessment documents active neurological progress in this patient's case. Your schedule reduction eliminated 2 of her 5 weekly sessions during a period of documented active recovery. The protocol you were required to follow before making that change was not followed. These are the facts in front of this panel. She paused. Is there something in the clinical record that contradicts those facts? A long silence. No, Holt said. The words sat in the room. Thank you, Ung said. The panel's preliminary findings were delivered verbally by Webb at 12:45 in the same conference room with all parties present. Formal written findings would follow within 5 business days, she said, and would be submitted to the State Board reviewer as part of the formal complaint response. She said this with the specific tone of someone delivering a verdict who would prefer not to be delivering it, but has concluded that delivering it precisely is less costly than anything else. Preliminary finding 1. The schedule modification had not been implemented in compliance with the facility's own protocol, which required 4 weeks of documented plateau evidence. The documentation did not exist. Preliminary finding 2. The independent specialist's in-person assessment was credentialed, thorough, and uncontradicted by the clinical record. Its findings regarding active neurological recruitment were accepted as valid. Preliminary finding 3. Effective immediately, Amelia Voss's therapy schedule was restored to 5 days per week. The restoration would be backdated in the record to the date of the initial reduction, meaning the period of reduced sessions would be documented as a protocol violation rather than a legitimate clinical decision. Preliminary finding 4. Dr. Holt would be removed from Amelia Voss's case, effective immediately, and a new supervising physiatrist would be assigned. Webb said all 4 findings in the same careful tone. She did not look at Holt during findings 3 and 4. Holt did not look at anyone. Amelia looked at the table. She had known, since Wednesday, that this was where the facts pointed. She had organized the documentation, built the case, filed the complaint, moved first when she understood she had to. She had done every part of this work. And still, hearing the findings delivered out loud in a room with 8 people and a wall-mounted screen and windows overlooking a parking lot in Millbrook, Colorado, produced something in her chest that was not triumph and was not relief, and was not quite either of those things, but was something adjacent to both. A settling, maybe. The specific sensation of a structure that has been held up by effort, finally finding solid ground. She let herself feel it for approximately 30 seconds. Then she said, "What's the timeline for assigning the new physiatrist?" Webb blinked. "We'll have someone in place by Monday. I'd like Sandra Okafor to have input into the protocol handoff. That can be arranged. And I'd like the backdated record correction to be in writing by end of day today." A small pause. "We'll have it to you by 4 o'clock. Marsh, beside her, made a small sound that was not quite anything definable, but that Amelia understood as approval. The panel adjourned. People stood, gathered papers, moved toward the door. Holt stood last. He picked up his folder, still closed, still organized, full of documentation that had not been enough, and he moved toward the door without looking at Amelia, and then he stopped. She had not expected him to stop. He didn't turn around. He said, toward the door, "I didn't intend for this to be what it became." She looked at his back, at the set of his shoulders, which was not the set of a composed man, but of a tired one. "I know that," she said, "but intent and impact aren't the same thing. You know that. You've been practicing medicine long enough to know that." He left without responding. The door closed. Sandra, collecting her binder, looked at Amelia with an expression she couldn't fully interpret. "You okay?" "Working on it?" "Yeah." Sandra tucked the binder under her arm. "Me too." The written record correction arrived at 3:58, which was technically before 4 o'clock, and suggested that whoever had drafted it had moved with urgency. Marsh reviewed it in the lobby, made 2 annotations requesting clarifying language on the backdating scope, and sent it back. The corrections returned at 5:12 with the clarifications incorporated. Marsh signed off and handed Amelia her copy. She held it for a moment. A single page, formal letterhead, language that was institutional and precise and entirely insufficient to describe what 12 weeks of this had actually been. She folded it and put it in her bag next to her notebook. Marcus was still in the lobby. He had been there all day. She had seen him twice through the lobby windows during the panel recess, once sitting and once standing with Rex near the automatic doors, as if the building's air circulation system had become insufficient and they had needed some outside assistance. When she came down in the elevator, he looked up and read her face the way she was learning he read most things, quickly, accurately, without making it a comment. "Done?" he asked. "For today." Rex moved to her, or she put her hand on his head. "The new Physiatrist starts Monday," she said. "They're backdating the record. Sessions restored immediately." She paused. "He's off my case." Marcus nodded once. He didn't say anything for a moment, and the silence was the kind that didn't require filling. Then, "Sandra texted me. She said you were terrifying in there." "She's being generous." "She said that verbatim." Amelia looked at the automatic doors, at the parking lot beyond them, at the two-lane road and the strip of pharmacies she had driven past every morning for 12 weeks. "I was just organized," she said, "and I had better data. That's usually all it takes." She almost said something to that, and then didn't, because what she would have said was that no, it was not usually all it took, that being organized and having better data was often completely insufficient in environments that prioritized hierarchy over evidence, and that what had made the difference here was not just the data, but Dorothea Marsh and Sandra Okafor and Dr. Yolanda Ferris, and a state board representative who had asked the right question at the right moment, and even Marcus Reeves sitting in the lobby all day with a dog who had crossed a room full of strangers to find her. She almost said that it had taken all of it, every piece. Instead, she said, "I need to go home. I'm tired. I'll walk you to your car." They went out through the automatic doors together, Rex between them, into the cold October air that smelled like pavement and the approaching evening. The parking lot was mostly empty at this hour. Amelia stopped beside her car, and Marcus stood 2 feet away, hands in his coat pockets, and Rex sat at her left wheel with the patient propriety of a dog who understood that some moments required stillness. "Marcus." She looked at him. "Thank you. For the intake records. For the introduction to your contact. For today." He shrugged slightly. "Rex needed the walk." "You keep saying that." "It keeps being true." She opened her car door. She looked at Rex, who was looking at her with the absolute attention he brought to these moments, the ones where she was about to leave his sight, which he had not entirely made peace with despite 11 days of living with her, and understanding, intellectually, that she always came back. "Monday," she told the dog. "Full schedule." His tail moved once. She drove home. The new physiatrist assigned to Amelia's case was Dr. Anita Flores, and she came on Monday morning with her own documentation, her own questions, and the specific manner of someone who has been briefed and has formed no prior conclusions. She was 46, direct, and in their first meeting she asked Amelia to walk her through the voluntary dorsiflexion finding herself, not from the file, but from her own experience of it. Amelia described it. The sensation, the effort, the quality of the movement. Flores listened without interrupting, which was not a small thing. "It'll fade if we don't work it," Flores said. "New pathway. We need to hit it consistently or the recruitment doesn't consolidate." "I know." 5 days, full protocol. Starting today?" "Yesterday," Amelia said. Flores almost smiled. Noted. They started that afternoon. Sandra was there, running the protocol she had built over 12 weeks and refining it now with Flores's input. And the session was hard and specific and pushed Amelia in ways that the previous week's reduced schedule had not. She came home tired in a bone-deep way that was different from the exhaustion of fighting. This was the exhaustion of work, productive and directional, and she sat at her kitchen table afterward with Rex against her leg and ate something she'd put together from things Marcus had apparently restocked in her refrigerator at some point in the last 2 days without mentioning it, and she didn't bother being complicated about how that made her feel. The State Board's formal written findings arrived Thursday of that week. They confirmed the panel's preliminary findings and added 2 items that had not been in the preliminary: a notation that the facility's internal flagging process had failed to address prior concerns raised by staff, a reference to Sandra's 2 previous internal reports, and a requirement that Halverson implement a mandatory third-party review process for all schedule modification decisions in its spinal cord unit, effective immediately. The requirement applied to the entire unit, not just to Amelia's case. Dorothea Marsh called when she received her copy. "They widened the scope," she said. "I saw. That means other patients get the protection too, current and future." A pause. "You understand what that means?" "I understand. This isn't just your case anymore. The precedent is set for the whole unit." Amelia thought about the 2 previous patients Sandra had tried to flag, the ones whose concerns had gone nowhere. She thought about them in the way she thought about patients she hadn't been fast enough for in the trauma bay. Not with guilt, because guilt was not productive and the work was always imperfect, but with the specific awareness that the gap between the system working and not working was filled with people, real people, who had needed something and not gotten it because the mechanism had failed. "Is there anything we need to do to formalize it?" she asked. "Eng's office handles the implementation oversight. We don't need to do anything further." Another pause. "Amelia, you can stop fighting now. You won." She sat with that for a moment. "I'll stop fighting when I can stand at those parallel bars." Marsh made a sound that was not quite a laugh and not quite something else. "Fair enough. Go do your therapy." She did. 3 weeks after the panel, on a Tuesday in the 3rd week of November, Marcus Reeve came to tell her that Rex's military service retirement had been formally processed, and that the adoption transfer was complete. She had signed the papers 2 weeks earlier, but the formal completion required processing through 3 separate offices in 2 different states, and the completion notification had arrived that morning. He sat across from her at the kitchen table and put the documentation on the table between them, and Rex was on the floor between them with his chin on Amelia's foot and his eyes half closed, which was his evening posture, the one he had settled into in the first 3 days and had not modified since. "It's official," Marcus said. "He's yours." She looked at the paperwork, looked at Rex. "He was always mine." "Yeah." Marcus looked at the dog. "I know." She looked at Marcus, and he looked back at her, and there was something in the room that had been building for several weeks and that neither of them had named yet, which she suspected was because they were both, in their different ways, people who moved carefully in territory they hadn't mapped. She didn't say anything about it tonight. She wasn't going to say anything about it tonight, but she looked at him long enough that naming it later became inevitable. "Are you staying in Millbrook?" she asked. "After the adoption processing, you don't have a reason to be here anymore." "I took a consulting position," he said. "Veterans Medical Advocacy. The contact I introduced you to, she offered me a part-time role. Starts in January." "In Millbrook." "In Millbrook." She looked at the paperwork again. Rex adjusted his chin on her foot. The kitchen was quiet, and the November dark pressed against the windows, and everything felt exactly as unresolved and as strangely okay as it had felt since the day a dog crossed a rehabilitation gym floor and pressed his face into her lap. "Good," she said. He nodded. They sat for another hour with the adoption paperwork on the table and Rex between them, and the conversation moved to other things. Floris's updated protocol, the Halverson unit's new oversight requirement, the veteran advocate contact Marcus was working with, which turned out to have implications Amelia had not thought through yet. She was thinking them through now, making notes in the spiral notebook she kept beside her, and Marcus was watching her write with the expression of someone who had decided they didn't need to understand every part of a process to trust where it was going. At 9 o'clock, she looked at the notebook and then at him. "There's something Marsh said," she said. "When the board findings came through, she said this wasn't just my case anymore. The unit oversight requirement, yes, but also—" She stopped, put the pen down. "Every patient who went through that unit before me, who had sessions reduced without the documentation, who took the plateau assessment at face value because they didn't have the background to know it could be challenged." She paused. "There should be something, a process, not a complaint, a resource. Something available to patients before they get to where I was." Marcus was looking at her carefully. "What kind of resource?" "I don't know yet." She tapped the notebook. "I'm working on it." He looked at her for a moment, and then at Rex, who had lifted his head and was watching Amelia with the specific attention he brought to moments when she was deciding something. "Can I ask you something?" Marcus said. "Yes." "When you were in that room, the panel, when Webb read out the findings," he paused. "What did that feel like?" She thought about it honestly, the way she thought about most things, without the comfortable distance of a prepared answer. "Like something settling," she said finally. "Like something that had been held up by effort for a long time was finally resting on something solid." He nodded slowly. "And then," she said, "about 30 seconds later, I started thinking about what comes next." He almost smiled. "Yeah," he said, "that tracks." Rex put his chin back on her foot. Outside the window, the November dark continued. Inside, the adoption paperwork sat on the kitchen table, official, processed, completed. And the notebook was open to a new page that was not yet full, and the woman who had been handed a ceiling and handed it back had started, quietly, to draw the shape of something she had not built yet but could already see. And somewhere in the Halverson Rehabilitation Institute, in the spinal cord unit now operating under mandatory third-party oversight, a patient Amelia had never met was in a session that would not be cut without documentation, being assessed by a process that had been changed because one person had refused to accept that the ending had already been written. The paperwork was done. The record was corrected. The panel had spoken. But the notification that arrived in Amelia's email at 9:47 that evening, from an address she didn't recognize, with a subject line that read, "Halverson Unit, Previous Patient Inquiry," was something that none of the panel's findings had addressed, and something that Dorothea Marsh had not mentioned, and something that opened, when she read it, an entirely different dimension of what had been happening inside those beige walls. She read it 3 times. Then she picked up her phone and called Marsh. It rang 4 times. Then, "Amelia, it's nearly 10 o'clock. I know, I need you to read something." A pause. "Send it." She forwarded the email. The phone was quiet for 30 seconds. Then Marsh said, very slowly, "Where did this come from?" "I don't know yet." "How many patients are named in this?" "4, Amelia said. "That I can see. There may be more." Another pause, longer. "This changes the scope." "I know." "Significantly." "I know." She looked at Rex, who had come to sit beside her chair with the attention he brought to late evenings and phone calls that mattered. "What do we do?" Marsh's voice, when it came back, had the quality Amelia had first heard in that 2-room office above the dry-cleaning shop. Direct, economical, and completely unimpressed by the size of the thing in front of her. "First we verify, then we file, and then—" a breath. "Then we go back." The email had been sent from a personal account. No institutional affiliation, no signature block, just a name Amelia didn't recognize and 4 paragraphs that described. In language that was careful and specific and clearly written by someone who had thought about it for a long time before sending it. A pattern that matched hers with a precision that made the back of her neck go cold. The sender's name was Renata Solis. Former patient, Halverson Spinal Cord Unit, discharged 14 months ago. Her session schedule had been reduced from 5 days to 2, not 3, in her 8th week of treatment. The clinical justification cited in her discharge summary was plateau assessment. There was no 4-week documentation. She had not known, at the time, that documentation was required. She had not known she could have challenged it. She had found Amelia's name through the State Board's public complaint registry, which listed active cases without patient details, but included the facility name and the nature of the complaint. She had put the pieces together herself. "I didn't know any of this was possible," she had written near the end of the email. "I thought it was just how it worked. I thought the doctor decided, and that was it. I've been in a different city for a year now, and I'm still trying to recover what I lost in those 6 weeks. I don't know if this helps your case, but I thought you should know you're not the only one." Marsh had been on the phone for under a minute before she said they needed to verify. Verification took 4 days. Marsh working through the board's public records, Amelia cross-referencing what she could access through the complaint registry, and a second email arriving on day 2 from a man named Douglas Frey, who had heard about the case through Renata, and whose situation was different in its details and identical in its structure. By Thursday, there were 4 confirmed prior patients, all spinal cord unit, all schedule reductions without compliant documentation, all assessed as plateau. The date stretched back 3 years. Marsh filed the expanded complaint on a Friday morning, and she called Amelia when it was done with the particular efficiency of someone reporting a task completed. "It's in," she said. "The board reviewer now has 4 corroborating cases alongside yours. The scope of the investigation has formally widened." What does that mean for the timeline? It means they're not reviewing a single incident anymore. They're reviewing a pattern. That triggers a different process, a formal investigative panel, rather than a standard complaint review. Wider authority. They can subpoena clinical records, interview staff, request documentation the facility hasn't voluntarily produced. And for Holt specifically, his license is now under active review. Marsh paused. "Amelia, what he did to you was wrong and it was sanctionable. What the expanded record suggests is that it wasn't a lapse in judgment, it was a practice." She sat with that for a moment. She had known it, in the analytical part of her, had known since the moment she understood the pattern well enough to name it. But knowing something and hearing it stated plainly in a professional's voice were 2 different things, and she let the difference register before she moved forward. "What do the other patients need from me?" she asked. "Nothing you're required to give. You've filed your complaint. The board takes it from here." "That's not what I asked." A pause. "Renata Solis is still in active rehabilitation in Phoenix. Her current physiatrist is doing good work, but she lost 6 weeks in a window that mattered. Douglas Frey has plateaued, actual plateau, this time, documented correctly, but his team believes it's partly attributable to the reduction in his Halverson sessions." Marsh stopped. "There's nothing you can do to recover lost time for them." "No," Amelia said, "but maybe I can make sure the next person doesn't lose it." The formal investigative panel convened 6 weeks later, in January, in a state board hearing room in Denver that was nothing like Halverson's conference room, larger, more formal, with a stenographer and a panel of 5 rather than 4, and the specific institutional gravity of a proceeding that carried real consequences. Amelia was not required to testify. She testified anyway. She prepared the way she prepared for everything, methodically, without flourish, stripping the language down to what was precise and provable. Marsh sat beside her. Sandra had submitted a written statement. Ferris appeared in person. The 4 corroborating patients, Renata Solis via video link from Phoenix, Douglas Frey in person, 2 others whose cases the board investigator had located independently through the subpoenaed records, were represented by the facts of their files, which the investigator had reviewed and organized into a chronological account that made the pattern visible in a way that a single case could not. Holt was present. He had legal representation, a healthcare attorney named Burroughs, who argued, methodically and without apparent success, that each decision had been made in good faith within the scope of clinical discretion. The board's lead investigator, a woman named Dr. Cecile Adwan, who had spent 20 years in rehabilitation medicine before moving to regulatory work, listened to every word of Burroughs's argument with the expression of someone who had heard variations of it many times and remained unimpressed by all of them. When it was Amelia's turn, she spoke for 11 minutes. She described the intake assessment, the plateau determination, the backdated memo, the Garrett-Pellman conversation, and what it had suggested about the source of his talking points, the documentation process, Sandra's flagged concerns that had gone nowhere through internal channels, and the voluntary dorsiflexion finding that had occurred while her sessions were reduced. She was specific. She did not editorialize. She let the facts carry the weight, because she had organized them carefully enough that they could. At the end, Adwan asked her one question. "What do you want the outcome of this proceeding to be?" She had thought about this question. She had expected it, in some form. "I want the patients who came before me to be acknowledged," she said. "I want the record to reflect that their treatment was not clinically sound. I want the unit at Halverson to operate under oversight that makes this pattern impossible going forward. And I want Dr. Holt to practice medicine, if he continues to practice, in conditions that prevent him from making unilateral decisions about patient trajectories without evidentiary support." She paused. "I'm not asking for his destruction. I'm asking for accountability. Those are different things." Adwan made a note. The stenographer's fingers moved. Holt, across the room, looked at the table. The panel deliberated for 3 days. Their findings arrived by certified mail on a Thursday in the 3rd week of January, addressed to Dorothea Marsh, who called Amelia before she had finished reading the first page. It's comprehensive, Marsh said. Her voice had a quality in it that Amelia had not heard before, not triumph exactly, but something that had been held in professional suspension for a long time and was now releasing. Read it to me. Marsh read. Dr. Marcus Holt's medical license was suspended for 90 days, effective immediately, with reinstatement contingent on successful completion of a supervised practice program and a mandatory review of clinical documentation standards. The suspension was publicly recorded in the state licensing database. Following reinstatement, he would be required to submit all schedule modification decisions in his spinal cord unit to independent peer review for a period of 3 years. The Halverson Rehabilitation Institute was required to conduct a full audit of all spinal cord unit cases from the preceding 5 years and identify patients whose schedule modifications had been implemented without compliant documentation. Those patients were to be notified individually and offered a formal review of their cases, including the option for independent clinical reassessment at the facility's cost. The facility was fined. The fine was not nominal. Constance Webb, as administrative director, was required to implement the third-party oversight mechanism the board had previously mandated, with monthly compliance reporting for 2 years. Sandra Okafor's documented concerns, flagged internally twice and dismissed twice, were formally noted in the findings as evidence of systemic failure in the facility's internal review process. The finding explicitly stated that her documentation had been accurate, and had she been heard, the pattern might have been interrupted years earlier. Marsh stopped reading. There was a silence. Sandra, Amelia said, "Yes." They put it in the official record. They did. She sat for a moment with the phone against her ear and Rex against her leg, in the kitchen where the paperwork had been on the table in November and where the notebook had been opened to a new page. And she thought about Sandra in the Bay 4 doorway on a Monday morning when a backdated memo had appeared in an intake folder, and the way Sandra had said he backdated it with the voice of someone who had been waiting for a very long time for someone else to see what she had been looking at. "I need to call her," Amelia said. "Go," Marsh said. "Call me later." She called Sandra. The phone rang twice and Sandra picked up and said immediately, "I heard." "How?" Eng's office sent a courtesy notification to clinical staff named in the findings. A pause. "Amelia, I know." "No, Sandra stopped, started again. "I've been here for 6 years. I flagged those concerns twice. The first time I thought I'd done something wrong, the way they responded. The second time I thought maybe I was seeing patterns that weren't there. And I stopped pushing internally because I didn't think—" She stopped again. "You didn't stop," Amelia said. "You kept the original documents at home. You testified. You documented everything the moment there was a context for it to matter. That's not the same as pushing. No, but it kept the door open, and when someone came through it, everything you'd saved was still there." A long pause. "Are you okay?" Sandra asked finally. "You, not the case. You." It was the same question Sandra had asked her months ago, on the phone from her car in the pharmacy parking lot, and the answer now was different from the answer then, though she was still working out precisely how. "Getting there," she said. "How's that for honest?" Sandra made a sound that was definitely a laugh this time. "It's the most honest thing you've said to me in months." February came with hard, cold, and the particular stillness of a Colorado winter that had decided to be serious about itself. Amelia's sessions with Flores continued 5 days a week, and the voluntary dorsiflexion, which had been small and imprecise and immediately fatigued in October, had become something more by February. Stronger, more consistent, less effortful in the way that new neural pathways became less effortful as they consolidated, not because the work was less, but because the path was clearing. She didn't talk about it much. Progress in incomplete spinal cord injury was not linear and was not guaranteed, and she had been a trauma nurse long enough to know that the space between better and whole contained multitudes, and that hope was most useful when it was specific and honest rather than large and untethered. She kept her notebook. She kept her data. She kept showing up. The parallel bars were on the far side of Bay 4, past the standing frame, past the resistance station, past the space where Garrett Pellman had once stood and told her the effort wasn't worth it. She had looked at them every session for 4 months. She had not tried them yet, because Flores had been systematic about the progression, and systematic was right, and Amelia was not going to undermine the process she had fought for by rushing the part that required patience. On a Tuesday morning in the second week of February, Flores said, "I think we try the bars today." Amelia looked at her. "Your left hip flexor is consistent. The dorsiflexion is consolidating. Your upper body is where it needs to be for supported standing." Flores paused. "It's not going to be clean. It's probably going to be hard and short, and you're going to be exhausted afterward." "I know. I want Sandra in the room." "I know." Flores looked at her for a moment. "You've been ready for 3 weeks. I've been making you wait." "I know that too." "You didn't push." "You had the data," Amelia said. "I trust the data." Sandra came in from the next bay. She had her documentation ready, because Sandra was always ready, because that was the specific kind of person she was, the kind whose reliability was not a performance, but a condition of being. She sat up at the observation station and looked at Amelia with an expression that contained several months of everything they had been through and did not try to compress it into words. Rex was at the far end of the bars. This had been Marcus's idea, offered quietly the previous evening when Amelia had mentioned what was happening the next morning. He had suggested it, and she had been quiet for a long moment, and then she had said yes, because she understood what he was suggesting, and she understood that it was right in a way that was not sentimental but structural. Rex had been the beginning of this, in the rehabilitation gym on a late October morning when everything was still in its worst configuration, and it seemed correct that he be at the end of it too, whatever the end turned out to be. Marcus had brought him in early and positioned him where Flores directed, calm, leashed, at the far end of the parallel bars where Amelia would be looking if she looked forward, and then stepped back to the edge of the room because this was not his moment, and he knew that. Amelia positioned her chair at the base of the bars. She set both hands on the bars at shoulder width. She breathed in the specific way she had learned, not the breath of someone preparing for something frightening, but the breath of someone preparing for something that required everything available. She pushed. The first effort produced a partial standing position. Hips lifted, weight transferred, legs engaged in the uneven and imprecise way of someone whose neural pathways were real but new and still learning the full vocabulary of what they were being asked to say. She was not upright. She was partway there, shaking, the effort distributed through her arms and her core and the left hip flexor that had been inconsistent for months and was, today, doing its job. She pushed again. It took 3 attempts and approximately 90 seconds of effort that cost more than anything she had done in 4 months of sessions, and it was ugly. Her form was wrong, her breathing was audible. She made a sound at the final push that she would not have chosen to make in front of other people, and made anyway, because the alternative was not making it to where she was going. She was upright, not fully extended, not stable without the bars, not standing in the way she had stood before the accident, which had been without thinking about it at all. Standing in the way that mattered today, which was with every system she had, and the 12 weeks of documented work she had refused to allow to be taken from her, and the 4 months since then that had built on it. 10 seconds. Rex, at the far end of the bars, lifted his head. His tail moved. Once, and then again, and then the slow, continuous movement of an animal who has waited for something for a long time and has now seen it arrive. She looked at him. She looked at the length of the bars between them, which was 6 feet, and felt like a different kind of distance entirely. "Okay," Flores said, very quietly. "Come down." She came down. She sat in her chair and her arms were shaking and she was breathing hard in the way that came after maximum effort, the body's honest accounting of what it had just done. Sandra was entering notes with the particular focus of someone who knows what they are documenting matters and is not going to miss a detail of it. Rex walked the length of the bars and came to her and pressed his face into her lap. She put both hands on either side of his scarred face, the same way she had the first morning in the gym, and she held on for a moment with her eyes closed and her breathing gradually steadying and the shaking in her arms slowly resolving into something that was just tiredness, clean and earned. "Hey," she said. Her voice was not entirely steady. "I made it." His tail moved against her leg. The Halverson audit took 4 months and identified 9 additional patients whose schedule modifications had not complied with documentation protocols. All 9 were notified. 7 requested the independent clinical reassessment the facility was required to offer. Of the 7, 4 were found to have experienced measurable disruption to their recovery trajectories attributable to the session reductions. 4 people. Amelia read the audit summary when Marsh forwarded it in June. She read it once, which was all she needed, and then she set it beside the notebook on her kitchen table and thought about what Marsh had said in February when the board findings arrived. This isn't just your case anymore. She had understood that then in the abstract. She understood it now in the specific. 4 names, 4 trajectories, 4 gaps in care that had been created by a practice that no one had successfully challenged before her. She was not responsible for any of them. She had not been their nurse, their advocate, their anything. She had simply been the person who had the right combination of background and documentation and stubbornness and support to make the fight visible enough that the system had to respond. She had been thinking about stubbornness a lot lately, about what it was and what it was for, and the difference between the kind that was just inflexibility and the kind that was load-bearing, the kind that holds something up that matters until the structure around it can be rebuilt to hold it up instead. The patient advocacy program she had been sketching in her notebook since November had taken shape by March, and had a name by April, the Clear Record Project. The name was Sandra's suggestion, offered at a Tuesday session in the way Sandra offered most useful things, without preamble, without making it a production. It was right immediately. It described exactly what the thing was supposed to do: help patients understand what their records contained, what documentation standards applied to their care, and what options existed when those standards weren't met. It was not a legal service. It was not a complaint filing service. It was a resource, a structured conversation, a plain language explanation of the protocols that governed rehabilitation treatment, a bridge between the institutional language of clinical documentation and the lived experience of a patient who had been handed a decision they didn't know they could question. Marsh agreed to serve on the advisory board. Sandra agreed to consult on clinical accuracy. Marcus connected her with the Veterans Advocacy Organization he'd been consulting for, which was interested in a parallel track for veteran rehabilitation patients specifically. Ferris contributed 3 hours of review time and her institutional affiliations, which gave the project credibility it would have taken years to build from scratch. It was not finished. It would not be finished for a long time, possibly ever, in the sense that things that do real work are never finished. They evolve and adapt and run into problems their founders didn't anticipate and solve them imperfectly and continue. She was prepared for that. She had been a trauma nurse. She understood the difference between a problem that was solved and a problem that was being managed, and she knew which category most of life's real problems fell into. Dr. Holt's license was reinstated in April, following completion of the supervised practice program. He returned to clinical practice at a different facility in a different city under the 3-year peer review requirement. Amelia did not follow this closely. She did not need to. The record existed in the state database, the oversight was in place, and the 4 prior patients whose cases had been formally reviewed had received the acknowledgement they were owed. What Holt did with the remainder of his career was a problem for the oversight mechanisms to manage. She had other problems to work on. She sent Renata Solis an email in May. Not about the case, but about the project. She explained what she was building and why, and asked, without any particular expectation, whether Renata would be interested in talking. The response came back in 2 hours. Yes, absolutely yes. When? She had not expected the phone call to last 2 hours. It did. Renata was funny and sharp, and had opinions about institutional rehabilitation culture that Amelia found herself agreeing with and then arguing against in the specific way you argue with people who are mostly right, but not entirely. And by the end of the call, they had identified 3 gaps in the project's current structure that Renata was going to help fill. Douglas Frey sent a card. Paper, handwritten, mailed to Dorothea Marsh's office with a note asking her to forward it. It said, "In full. I didn't know what I didn't know. Now I do. Thank you for making the record." She kept the card in the notebook. The first Clear Record Project information session was held in June in a borrowed conference room at the Denver Rehabilitation Medicine Continuing Education Center, with 11 patients who had been referred by their current therapists and 3 therapists who had come because they'd heard about it and wanted to understand what it was. Amelia ran it from her wheelchair, which was not a statement. It was just where she sat, the same way she had always sat, the same way she would continue to sit until the day she didn't, which would be the day it happened and not before. She talked for 40 minutes. She did not talk about herself directly. She talked about documentation standards, about the right to question clinical decisions, about the specific language that appeared in rehabilitation protocol documents and what it meant in practice. She made it concrete and specific and entirely free of the particular brand of inspirational language that she had never been able to tolerate even when she was the intended recipient of it. She answered questions for another 40 minutes. They were good questions, the kind that came from people who were sitting in rooms where decisions about their bodies were being made in language they hadn't been given the tools to navigate. She answered all of them, and for the ones she couldn't answer, she said clearly that she couldn't answer them and wrote down what they would need to find out and who they would need to contact. At the end, a woman in the third row, 50s, post-stroke rehabilitation, a brace on her left arm, raised her hand and said, "Did you ever get to stand up? After everything?" The room went quiet. Amelia thought about the parallel bars in February, the 90 seconds in 3 attempts, and the sound she'd made at the final push, the 10 seconds upright with Rex at the end of the bars and the shaking in her arms and Sandra's pen moving across the documentation form. "Yes," she said. "How far?" She thought about this question the way she thought about most hard questions, directly and without softening it. "I can walk about 20 feet with the bars and supervision," she said. "My sessions are still 5 days a week. My recovery is real and it's incomplete, and I don't know exactly where it ends. Nobody does." She paused. "But I know where I am today, and I know it's further than the ceiling someone tried to put on me." The woman nodded slowly. Her eyes were wet, and she didn't try to hide it, which Amelia respected. "That's enough," the woman said. Not to Amelia specifically, to the room, or to herself. "That's enough to know." On a Saturday in July, Marcus drove them to a trailhead outside Millbrook that had a wide, paved, accessible path running along a reservoir for 2 miles. He had found it on a map and mentioned it without making it an event, which was how he handled most things. And she had said yes without making it an event either, which was how they had arrived at the particular kind of ease between them that had taken months to build, and that neither of them was in any hurry to define more precisely than it currently was. Rex ran ahead on the long lead, not sprinting, just moving with the loose, deliberate energy of a dog who had been cooped up in a city apartment and had found the smell of open water and grass and something unidentifiable but interesting in the direction of the tree line. He circled back every few minutes. He always came back. Marcus walked beside her chair without hovering, which she had established as a requirement early on, and which he had adapted to without comment. The path was good, smooth asphalt, no significant grade, the kind of infrastructure that existed because someone had decided it should and had made it happen. She had been thinking lately about the people who made that decision, the unnamed, unbothered competence of people who fix things without requiring recognition for it. "The second clear record session is in August," she said. "I know. You told me." "Renata is flying in. She's going to talk about the Phoenix rehabilitation system. What's different there? Comparative context." "Good." He watched Rex veer toward the water's edge and veer back. "How many people have signed up?" 22. We had to cap it." She paused. "We're going to need a bigger room." He was quiet for a moment. "You know what I kept thinking about," he said, "when I was sitting in that lobby during the panel day?" "What?" "The intake form, the one with your name in the second line." He looked at the reservoir, which was flat and silver in the morning light, and entirely indifferent to everything that had happened in the past 9 months. "I almost didn't bring Rex in that day. The evaluation slot was the only appointment available, and I almost rescheduled because I don't even remember why. Something about parking." She looked at him. "Parking. I know." A dog who had been searching for 5 years almost didn't find the person he was looking for because of parking. "I know." He paused. "I'm just saying, there are a lot of small decisions in a thing like this, a lot of places where it could have gone differently." She thought about that, about all the small decisions, the ones she had made and the ones other people had made, and the ones that had nothing to do with intention at all, like a parking situation and an available appointment slot and the specific layout of a rehabilitation gym that meant a dog coming through the far door had a clear sightline to a woman at the parallel bars 60 feet away. "I used to think," she said slowly, "that the thing that mattered was being ready when the moment came, having the knowledge the documentation, the capacity. She paused. I still think that's true, but it's not the whole thing. What's the rest? Being findable, she said, staying in the room, not disappearing before the thing that's looking for you gets there. Rex came back from the water's edge and shook himself enormously and walked to her chair and looked up at her with the expression she had come to understand as his version of checking in, confirming that she was still there, that the situation was stable, that he had not been away from her side for too long. Hey, she said. He leaned against her wheel. She looked at the reservoir and the path ahead, and the morning that had nothing in it yet but the three of them, and the wide Colorado sky, and the particular feeling of a day that had not been assigned a purpose beyond being whatever it turned out to be. She was not healed in the sense that meant finished. Her ankle was stronger, and her sessions were hard, and her record had been corrected and the ceiling was gone, but her body was still the body it was, imperfect and ongoing and full of work that hadn't been completed yet. She did not expect completion. She had been a trauma nurse for 12 years. She knew that the human body was not a problem to be solved, but a system to be supported, and that the support had to be consistent and honest and willing to revise its conclusions when the evidence demanded it. She expected that of her body. She expected it of herself. She expected it of every system she moved through, and when those systems fell short of it, she now had a notebook and a documentation process and a project with a borrowed conference room and 22 people in August and a patient advocate with 17 years of experience and a physiatrist who had come in person to prove what was real. That was not nothing. That was in fact everything, not in the sense of complete and resolved, but in the sense of sufficient. Enough foundation to build on, enough ground to stand. She pushed forward on the path. The reservoir was flat and silver on her left. Rex trotted ahead and then back. Marcus walked beside her at the pace she set, which was the correct pace, which was hers. She thought about the intake form with her name in the second line. She thought about a backdated memo in a folder. She thought about Renata Solis in Phoenix and Douglas Frey's handwritten card, and 4 patients whose trajectories had been disrupted, and Sandra's flagged concerns finally in an official record, and a dog who had crossed a room full of strangers to find her. She thought about the moment at the parallel bars, the shaking and the sound she'd made, and the 10 seconds upright and Rex's tail at the end of the bars, moving. Here's what she understood now that she had not fully understood before any of this. The wheelchair had never been the measure of her. It had been part of the landscape she moved through, the same way the accident had been part of her history, and the panel had been part of her record, and the project was part of her future. None of those things were her. They were the terrain. She was the person navigating it. The hardest thing about being underestimated, she had learned, was not the underestimation itself. The hardest thing was the way it invited you to participate in it. The quiet daily pressure to accept the ceiling, to stop measuring what you measured, to fold the notebook and trust the assessment of someone who had spent 12 minutes deciding your ending. The hardest thing was refusing that invitation, every single day, without the guarantee that refusing it would be enough. It was not always enough. She knew that now in a way she hadn't before. For some patients, the mechanism had failed completely, and they had lost time they would not recover, and the audit had found them and the acknowledgement had come, but the time was still gone. That was true, and it mattered, and she carried it. And still she had refused the invitation, and still it had mattered, and still the record had been corrected and the system had been changed, and 22 people were coming to a conference room in August. That was not a lesson about her specifically. It was not proof that refusing is always enough, or that documentation always wins, or that institutions always correct themselves when confronted with evidence. None of those things were reliably true. It was something smaller and more durable than that. It was the simple, unspectacular fact that people who stay in the room, who keep the documentation, who ask the question one more time when the first answer wasn't sufficient, they change the specific situation they are in. Not always dramatically, not always completely, but specifically, measurably, in ways that the next person who comes through the same door can build on. She had come through a door that someone else might come through next. She had left it a little more open than she'd found it. That was enough. That was in fact everything she had ever asked medicine to give her. Not a cure, not a resolution, not a clean ending, but sufficient evidence that the work was real and the progress was documentable and the next session was worth showing up for. Rex came back to her side and matched her pace. The path went on ahead of them, wide and flat and entirely navigable, and the morning was still early, and the day had not yet decided what it was going to be, and Amelia Voss moved forward into it with her hands on her wheels and her notebook in her bag, and everything she had learned about what it meant to stay in the room when someone wanted you to leave it. She moved forward. That was all. That was everything.